cyclic AMP. Direct question has been asked. Okay. We found that many enzymes are there which are activated by insulin. What insulin will do? Insulin will cut phosphate and will activate, means dephosphorylation of enzyme. Okay. Yes. Okay. Glucagon attach phosphate with the help of glue. Yes, attach phosphate with the help of glue. Yes, this question has been asked in our FMG exam that this method of regulation of enzyme means few enzymes are regulated by phosphorylation and dephosphorylation. Means if you attach phosphate to an enzyme, few enzymes are activated while few enzymes are inactivated. And phosphate is attached to that enzyme by covalent bond. So that is called covalent modification. So question was asked, this is the method of enzyme regulation by covalent modification. Okay, friends. Glucagon and insulin are exactly opposite. Suppose this is cyclic AMP. I simplify. Okay. Cyclic AMP. Insulin will cut this. Okay. Insulin do incision. Cut. So decrease cyclic AMP. Glucagon has bottle of glue. Yes. It will join this again. So increase cyclic AMP. Direct question many times. Increase cyclic AMP. Okay. You will find. And in January 25, they ask that method of regulation of enzyme by phosphorylation and dephosphorylation. This is method that is categorized as covalent modification. Okay. Now, insulin loves lipoprotein lipase. Lipoprotein lipase. Insulin hates hormone sensitive lipase. So loves means activate. Hates means inhibit. This question has been asked multiple times. Okay. This NEET 24, they ask question, the same question with little bit modification, just diabetes. In diabetes, insulin is not there or not working. If insulin is not there, insulin decrease. You can see, remember like this. So lipoprotein lipase will not be activated. So lipoprotein lipase will be decreased. Hormone sensitive lipase will be activated. So hormone sensitive lipase increased. What is the answer? Please do comment. Yes, answer is B. Answer is B. So I have tried to cover most of the PYQ. It may be NEET, INI, FMG, so that we would be able to secure very good marks in biochemistry. Okay. Now, on this page, all the pathway are activated by insulin, first of all. Simple mnemonic. Yes, we found that whenever we take diet, blood glucose increases. Whenever you take diet, खाना खाते हो तो blood glucose increase होगा. Yes, this glucose goes to pancreas and stimulate pancreas to release insulin. Yes, insulin increases. And insulin activate all the pathways shown in on this page. Yes, let me tell you. First pathway, I can say production of energy by glycolysis. Glucose is converted to two molecules of pyruvate by glycolysis. Glycolysis. And yes, glycolysis rate limiting enzyme, phosphofructokinase. Phosphofructokinase. So phosphofructokinase is rate limiting enzyme of glycolysis. It is activated by insulin. This is insulin. Insulin injection. We do remember it as insulin injection. Okay. So activate phosphofructokinase. And insulin remove phosphate. And you know, whenever it remove phosphate, it activate phosphofructokinase. So phosphofructokinase is active in dephosphorylated state or phosphorylated state. Please do comment. This question has been asked recently. Yes. So insulin remove phosphate and activate phosphofructokinase. So phosphofructokinase is active in dephosphorylated state. Now, second fate of glucose is it can be converted to glycogen, which is stored in muscle and liver. And the rate limiting enzyme of glycogen synthesis is glycogen synthase. Glycogen synthase. Insulin also activate this rate limiting enzyme of glycogen synthesis, and it is also active in dephosphorylated state. It is also active in dephosphorylated state. Phosphorylated state. So this question has been asked recently in INI, okay? Phosphokinase, glycogen synthase, active in dephosphorylated state. Now, another fate of this glucose is HMP shunt. Another name of HMP shunt is pentose phosphate pathway, PPP. Okay, so it produces NADPH. And how many ATPs are produced from NADPH? No ATP, zero ATP. NADPH is not used for energy production. It is used for reductive biosynthesis. Wherever we want reduction, most of the places you will find that NADPH will come. Okay. For the time being, HMP shunt, two function. One is to provide NADPH. It is not going to produce energy. Second, it provide pentose sugar. Pentose sugar. That's why it is also called pentose phosphate pathway, PPP. Okay. Now, rate limiting enzyme of HMP shunt is glucose 6-phosphate dehydrogenase. Rate limiting enzyme. Rate limiting enzyme. It is also activated by insulin. So, whenever you take diet, blood glucose increases. Now, what is the fate of this glucose? Glucose will be converted to glycogen. Glucose will be converted to glycogen. This will be activated by insulin. Glucose will be converted to pyruvate by glycolysis, activated by insulin. Some glucose will enter HMP shunt, yes, and will produce NADPH. Now, we found that pyruvate is further metabolized inside the mitochondria. In mitochondria, pyruvate is converted to acetyl coenzyme A by pyruvate dehydrogenase. Pyruvate dehydrogenase. And this is also activated by insulin. I told you on this page, all the pathway, all the enzyme I have shown till now and will discuss will be activated by insulin. So many integrated question has been asked in our FMG, so we can't leave this. Okay, so pyruvate dehydrogenase is activated by insulin. Recently asked question. If I ask, yes, insulin decrease cyclic AMP, very good. Yes, insulin activate this pyruvate dehydrogenase. So this is active in phosphorylated state or dephosphorylated state. It is also active in dephosphorylated state. Yes, it is also active in dephosphorylated state. Now, acetyl coenzyme may enter Krebs cycle. I have not shown here. For the time being, yes, I know acetyl coenzyme main function is to produce energy by Krebs cycle, but I avoided it. Acetyl coenzyme, extra acetyl coenzyme are thrown out of the mitochondria. This is mitochondria. Okay, this circle is mitochondria. I highlight this is mitochondria. Outside the mitochondria is cytosol. Outside the mitochondria is cytosol. Okay. Now, this acetyl coenzyme can take part in fatty acid synthesis, can take part in cholesterol synthesis. And fatty acid synthesis rate limiting enzyme is acetyl coenzyme carboxylase. Acetyl coenzyme carboxylase. Acetyl coenzyme carboxylase. And cholesterol synthesis, HMG coenzyme reductase. These are also activated by insulin and active in dephosphorylated state. Now, we found that all these pathway, yes, are activated by insulin. If I ask you that this pyruvate dehydrogenase till now in mitochondria, all other pathway occur in cytosol. If I ask you glycogen synthase occur in, you will say it's a cytosol. Outside this, everything is cytosol. So glycogen synthesis in cytosol, HMP shunt in cytosol, glycolysis cytosol, fatty acid synthesis cytosol, cholesterol synthesis occur in cytosol. Yes, by pyruvate dehydrogenase catalyzed ring reaction that occur in mitochondria. Okay, mitochondria. Okay. Yes, you have seen this animation, but this becomes important. That's why I'm showing you again, although this is a very rapid discussion. Even then, we can see this. When you take food, yes, blood glucose increases. Glucose goes to pancreas, release insulin. Insulin remove phosphate from glycogen synthase. Glycogen synthase is activated. It convert glucose to glycogen. Yes, stored in liver and muscle. Stored in liver and muscle. Now, glucose 6-phosphate dehydrogenase, that HMP shunt, it produce pentose sugar, NADPH. Insulin activate phosphokinase by dephosphorylation. Glucose enter glycolysis, produce two molecules of pyruvate. Now, pyruvate enter the mitochondria. Pyruvate dehydrogenase also activated by insulin by dephosphorylation. Pyruvate is converted to acetyl coenzyme. This acetyl coenzyme enter Krebs cycle. Yes, one acetyl coenzyme produces 10 ATP. When energy required is fulfilled, extra acetyl coenzyme are thrown out of mitochondria. Yes, now acetyl coenzyme is converted to fat by acetyl coenzyme carboxylase. It is also activated by insulin by dephosphorylation. Acetyl coenzyme joined to form cholesterol, and ultimately triacylglycerol is formed, that is stored in, yes, माँ का प्यार, मोटू पतलू का पेट. Yes. So this is about fed state. We can easily remember that all these pathways are activated by insulin. Their enzymes are activated by insulin. So these are activated by insulin. Okay. And their rate limiting enzymes are also activated by insulin. Now, okay. Now, in fasting state, this topic has become a little bit favorite for examiners. Fasting state, if you are not taking food, if I lock you in a room and don't give you food, then what will happen? Up to 16 to 18 hours, no need to worry, liver glycogen will be broken down to maintain blood glucose. Not muscle glycogen. Muscle says myself, मेरा glycogen है, मैं नहीं दूंगी. मैं नहीं दूंगी. Huh? Yes. So liver says that yes, liver glycogen is broken down, okay, to maintain blood glucose, and it can maintain blood glucose up to 16 to 18 hours, glycogenolysis. First question. In fasting state, insulin decreases, glucagon increases. Glucagon increases. Glucagon activate hormone sensitive lipase. Yes, hormone sensitive lipase and fatty acid is released. Now, if you are in fasting state up to 48 hours, then what will happen? Liver would say, don't worry, I will maintain blood glucose by gluconeogenesis. नया ग्लूकोज बनाऊंगा. यस, लीवर ने कहा नया ग्लूकोज बनाऊंगा. यस, सड़क से उठा के स्टार बनाऊंगा. यस, gluconeogenesis means I will convert non-carbohydrate to carbohydrate, will maintain blood glucose up to 48 hours. Meanwhile, beta oxidation also occur. Okay, but predominate pathways gluconeogenesis. But if you are in fasting beyond 48 hours, yes, then beta oxidation predominate. Yes, and gluconeogenesis also occur, but liver is not able to maintain blood glucose so much by gluconeogenesis. That's why liver has plan C. Don't worry, I will do beta oxidation and will synthesize ketone bodies. Yes, this beta oxidation of fatty acid will produce acetyl coenzyme which take part in ketone body synthesis. So ketone body synthesis also occur in mitochondria. This is mitochondria. Okay. So why these ketone bodies are important? Yes, most vital organ utilize ketone bodies in starvation. Yes, most vital organ, bheem, chota bheem. So brain, heart, and muscle, skeletal muscle. You know, brain is very vital. बड़ा इंपॉर्टेंट है, यदि ब्रेन गया तो सब गया। यस। हार्ट, यस हार्ट तो तुम्हारा बहुत वाइटल है। मसल इज ऑल्सो वाइटल, यू नो दैट वन इंपॉर्टेंट मसल व्हेन यू आर स्लीपिंग दैट इज ऑल्सो वर्किंग in the morning. You must have experienced that, especially boys. That is important for boys and girls both. Yes, in different ways, but that is important. So most vital organ, nature ने कहा most vital organ, yes, brain, heart, and skeletal muscle or muscle utilize ketone body in starvation. Okay, so a minor stuck in tunnel for 5 days. What is the source of energy for the brain? बहुत लंबा टाइम हो गया. Yes, brain will utilize ketone bodies for survival. Yes, recently asked question. During starvation, which of the following hormone primarily produced to maintain blood glucose level? Yes, glucagon increases. That glucagon increases. Okay. Yes. Okay. Yes. So now you can see ketone body synthesis and ketone body utilization both occur in mitochondria. Beta oxidation of fatty acid also occur in mitochondria. Gluconeolysis, I don't comment. But glycogenolysis, you can say outside the mitochondria. Now you know all the pathways. Yes, all the pathway which occur in mitochondria and which occur in cytosol. Okay. So which pathway occur in which compartment? No need to mug up. We have learned by this. Glycogen synthesis occur in cytosol. HMP shunt, cytosol. Glycolysis, cytosol. Fatty acid synthesis, cytosol. Cholesterol synthesis, cytosol. Glycogenolysis, cytosol. Now, Krebs cycle I have not mentioned here, but TCA cycle occur in mitochondria. Beta oxidation, mitochondria. Ketone body synthesis, mitochondria. Yes, ketone body utilization, mitochondria. Okay, so this is cytosol. These are cytosol. These are mitochondria. Okay. Yes. Glycolysis, glycogen synthesis, glycogenolysis, HMP shunt, fat synthesis, fatty acid synthesis, cholesterol synthesis, all these are occurring in cytosol. Link reaction, pyruvate dehydrogenase, TCA cycle not shown, beta oxidation of fatty acid. Yes, ketone body synthesis and ketone body utilization all occur in mitochondria. Yes, now pathway which occur both in mitochondria and cytosol. Hug प्यारी, प्यार से हक करते हैं, दो बंदे हक करते हैं. यस, दो कंपार्टमेंट में होगा. यस, इंग्लिश वाला हग, हिंदी वाला नहीं. यस, हीम सिंथेसिस, यूरिया साइकिल, ग्लूकोनियोजेनेसिस. ओके, एंड pyrimidine synthesis occur in both mitochondria and cytosol. Okay, now these are metabolic fuel you can easily remember, but yes, if you are in fat state, you have sufficient amount of glucose. So most of the organs will utilize glucose. So liver utilize glucose, brain utilize glucose, skeleton also utilize glucose, RBC utilize glucose, but heart utilize fatty acid even in fat state. क्यों? Why? दिल तो पागल है, दिल दीवाना है. क्यों कहते हैं पागल, क्यों कहते हैं दीवाना? Yes, you have so much of glucose, but you are utilizing fatty acid. There's a mnemonic, so you will never forget that. Yes, this was FMG question. In our FMG, they asked question that heart utilize fatty acid even in fat state. Okay. Now, fasting state, if you know fasting, FA, so fatty acid. But brain utilize glucose in fasting state because fatty acid can't cross blood-brain barrier. Fatty acid can't cross blood-brain barrier. And RBC utilize only and only glucose. RBC, simple mnemonic, RBC is traveling via blood. And blood is always having glucose. So whenever it will feel hungry, it will take glucose and will enjoy. मिठाई की दुकान पे बैठे हो तो मिठाई की कमी थोड़ा ही होगी, है? So RBC travel in blood, so utilize only and only glucose as it has no mitochondria. इसमें mitochondria नहीं होता. Nature is very wise. Nature decided that okay, RBC is always in blood, so remove remove mitochondria and the space will be utilized for hemoglobin. So because the main function is to transport oxygen and that will be done by RBC. Okay, so RBC utilize only glucose, glucose, glucose because entertainment, entertainment, entertainment because it has no mitochondria. Okay, now in starvation, I told you that most vital organ, if you remember, that is sufficient brain, heart, and muscle utilize ketone body in starvation. Okay. Now, next, mucopolysaccharides. This is really important for our FMG. Mucopolysaccharide, also called glycosaminoglycans. Yes, the hyaluronic acid, keratin sulfate, dermatan sulfate, heparan sulfate, so many glycosan, yes, are there. These glycosaminoglycans means hyaluronic acid, keratin sulfate, dermatan sulfate, they absorb a large amount of water to make mucoid structure. Mucoid, गंदे वाली है ना, mucoid structure. That's why they are called mucopolysaccharides because they form mucoid structure. So in NEET a question was asked that they absorb large amount of water or they absorb less amount of water. So they absorb large amount of water. Okay, they have negative charge. This question in NEET that glucosamine is used in arthritis. Glucosamine is used in, yes, arthritis. So we found that frequently asked hyaluronic acid. Hyaluronic acid is frequently asked. No sulfate. कोई सल्फेट नहीं होता. Okay. And H4 hyaluronic acid, H4 healing, wound healing. Recently asked question in our FMG, wound healing. Present in synovial fluid and vitreous humor. Again, question of our FMG. In INI or all India, you will find an image-based question in which this image was given, and they ask the question that this glycosaminoglycan is. The catching point was there is no sulfate. You can see the structure. You can see the structure. No sulfate, no sulfate, no sulfate, no sulfate. So if a given structure is not having sulfate, without second thought, if they ask mucopolysaccharide, you will mark the answer hyaluronic acid. This was, yes, question. So they may ask on the structure, should ask only on two, hyaluronic acid and keratin sulfate. Yes, reason I have discussed in our main class. They will ask on these two because they have specific feature, no sulfate. If you find the structure, look at the keratin sulfate, you will find sulfate is there. Dermatan sulfate, sulfate is there. Heparin, sulfate is there. But hyaluronic acid, no sulfate. Got the point? Now, second question more frequently asked, keratin sulfate, no uronic acid. No acid, no uronic acid. So if they give structure and you find that this two images are means two cycles are there, okay, cycler structure is there, then how you will identify? You can't find any COO. In keratin sulfate, COO is not there, and that is keratin sulfate. Yes, जहां कीर्तन करते हैं वहां यूरिनल नहीं बनाते. कीर्तन जानते हो ना, कीर्तन करते हैं तो वहां यूरिनल नहीं बनाते, तो नो यूरोनिक एसिड. And kerato word is used for cornea. Keratoconus, keratoplasty. Yes, keratoconus, keratoplasty. Kerato word is used for cornea. So keratin sulfate is responsible for transparency of cornea. So these are recently asked question. Now, mucopolysaccharidosis commonly asked, those are MPS type 1, 2. MPS 1H and S. MPS 1 is MPS 1H and S. H, Hurler disease, S, She disease. In both Hurler and She disease, enzyme deficient is iduronidase. Iduronidase is deficient. So how you will identify? Yes, H4 whole. H4 whole. Complete deficiency. If iduronidase, complete deficiency, whole, this is Hurler disease. In this, mental retardation would be there or intellectual disability. Okay. She disease, partial deficiency. S for slight deficiency in this no mental retardation. So yes, they sometimes ask clinical scenario, they give clinical scenario, and they will give you the enzyme also that iduronidase is deficient. And they will mention mental retardation is there. If mental retardation is there, so definitely answer would be Haller. And if they mention no mental retardation, no intellectual disability, so answer would become disease. MPS 1S. MPS type 2 hunter's disease. You must have seen old movies in which big bungalow of villain and they used to have two guns and the face of lion like this. I have not lion here, but I have written hunter, but that face of lion, this is hunter. Two guns looking like X. So this is X-linked recessive. MPS type 2 hunters looking like X. So X-linked recessive. All other mucopolysaccharidosis are autosomal recessive. This is X-link. If X-link more common in male than female, and if you are hunter, your vision should be clear. Otherwise, you will be hunted. विजन साफ होना चाहिए नहीं तो शेर खा जाएगा भाई तो यस नो corneal क्लाउडिंग नो corneal क्लाउडिंग एंड यस मोर कॉमन इन मेल ऐसे तुम्हें वैसे याद होगा शिकारी यूजुअली मेल ही होते हैं एक दो डाकू हसीनाएं होती हैं यूजुअली शिकारी आर मेल और तुमने गाना भी सुना होगा हनी सिंह का मैं हूं शिकारी कुड़िए खाली मेरा वार ना जाए यस तेरे घर अखबार नहीं आता यस चलो मिक्स तो नहीं कर दिया मैंने दो गाने एनीवेज हमने याद रहेगा कि हंटर्स आर मोर मोर कॉमन इन मेल्स ओके yes this question was asked FMG Natovis disease in this mnemonic is nata nata छोटे को कहते हैं स्मॉल साइज नाटा छोटा नाटा छोटा short stature okay N49 N49 MPS type 9 MPS type 9 so NATO is 9 short stature joint pain nata chota okay now hyaluronidase is deficient high high नहीं बढ़ी हाइट नहीं बढ़ी अपने आप कह रहा है yes nata chota height नहीं बढ़ी means hyaluronidase is not there so hyaluronic acid will accumulate yes so hyaluronic acid accumulate that is answer D so you will remember hope you are enjoying the session I know that I kept as I promised that we will keep few questions also so that we can revise the content and questions also in the last and definitely it will help and we will clear this exam very easily with a positive thinking and rabbit smile. Yes. Okay. So till last, you will be positive, not HIV positive. बस HIV पॉजिटिव नहीं होना बाकी सब पॉजिटिव रहना है यस ओके चलो बच्चों सुक्रोज ट्री हेलोज sucrose, trehalose, maltose, lactose. We found that these are disaccharides. Disaccharide, one unit is glucose. We have to find the second unit. Yes, Sukravar Friday. So in disaccharide, usually one unit you know. Yes, sucrose. Yes, Sukravar Friday. So second unit is fructose. Lactose, one unit is glucose, second unit just add Ga, galactose, second unit is galactose. Maltose, mal, yes, both units are glucose. यदि maltose को देखोगे तुम क्या कहोगे mal आ गया. Yes, glucose is good. Yes, so both units are glucose. Both units are glucose. Trehalose also, both units are glucose. mal आएगा तो try तो करोगे भाई, है ना? Try नहीं करोगे? Yes, trehalose. So the trehalose and maltose both units are glucose. Recently in INI में simple question was asked Benedict test detect reducing sugar. Benedict test detect reducing sugar. But sucrose and trehalose are known reducing sugar. Mnemonic we remembered. No rest. अब तैयारी कर रहे हैं तो rest नहीं लेंगे. No rest. Known. RE for reducing. S for sucrose. T for trehalose. T for trehalose. So non-reducing are sucrose and trehalose. INI, they gave sucrose in the option, that is non-reducing sugar. Okay. In FMG, our FMG lactulose, they ask, lactulose is made up of galactose and yes, fructose. Lactulose is used so frequently in constipation. अब निमोनिक क्या बनाया था तुम्हारी गर्लफ्रेंड को? कॉन्स्टिपेशन हुआ तो क्या दोगे? लैक्टुलोज, हाँ? यस, ओके, यस, लैक्टुलोज, गर्ल, गैलेक्टोज को यूजुअली मैं गर्ल ही मान के चलता हूँ, फ्रक्टोज फ्रेंड बना लेते हैं, है ना? नेक्स्ट क्वेश्चन वाज आस्क्ड in our exam, which of the following is excreted in patient with pentosuria or essential pentosuria? Okay, essential pentosuria or pentosuria. We found that normally L-gylulose is converted to xylitol by gylulose reductase. Yes, yes. पेंट कहाँ पहनते हैं? लेग में तो पहनते हैं. यस, एल, सो याद रहेगा, पेंट से एल याद रहेगा तुम्हें, नोटी बॉयज. तो तो एल जाइलुलोज is converted to xylitol. If this enzyme is deficient, then it is essential pentosuria. L-gylulose will be excreted in urine. Yes, it will not be reabsorbed. It will come in urine. So Benedict test would be positive. Next time they can ask question. Benedict test positive. And patient would be asymptomatic. Patient would be asymptomatic. Okay. Got the point? Answer is A. Next. Glycolysis, so frequently asked topic. Okay. In this, three irreversible steps are there. Three reversible steps are there catalyzed by kinases: hexokinase, phosphokinase, and pyruvate kinase. Three irreversible steps, or these are regulatory enzymes. Point it out. What regulatory enzymes? So if they ask regulatory enzymes, then three: hexokinase, phosphokinase, and pyruvate kinase. But out of these three, the rate limiting enzyme is phosphokinase. Okay, dear. Now, we found that enolase, one enzyme enolase, is inhibited by sodium fluoride. Mnemonic. Mnemonic is EFG. Enolase, E for enolase, is inhibited by fluoride. G for gray vial. For blood glucose estimation, we use gray vial. For blood glucose estimation, we use gray vial. Okay, and in this gray vial, we have fluoride, which inhibit enolase. Got the point? Now, if pyruvate kinase is deficient, then it lead to pyruvate kinase deficiency, lead to hemolytic anemia. This is second most common enzyme deficiency leading to hemolytic anemia. Hemolytic anemia. Okay. Second most common enzyme deficiency leading to hemolytic anemia. You know, glycolysis can occur in aerobic condition and anaerobic condition. In anaerobic condition, the end product is lactate. In RBC, mitochondria is not there. Point it out. In RBC, mitochondria is not there. That's why ultimately lactate is produced. Okay. If pyruvate kinase is deficient, this step would not occur, so lactate will not be produced. So in hemolytic anemia due to pyruvate kinase deficiency, lactate level will be decreased. Yes, why this is important? Because in G6PD deficiency, because 6-phosphate dehydrogenase deficiency, most common enzyme deficiency leading to hemolytic anemia. Yes, lactate level is increased. Lactate level is increased. So sometimes they will give you features of hemolytic anemia, okay, and they will point out lactate level. If lactate level is decreased and hemolytic anemia due to enzyme deficiency is there, you will consider pyruvate kinase. If they say lactate level is increased, then G6P deficiency. Okay, so remember this point means this is the biochemical difference. A question has been asked previously that a professor is taking round when intern was there. They were evaluating a patient of hemolytic anemia. Consultant asked, what is the most common enzyme deficiency leading to hemolytic anemia? And the intern replied, G6P deficiency. And he asked second most common, that is pyruvate kinase deficiency. Then he asked how you can differentiate these two by one only biochemical test. By one biochemical test, you can differentiate very easily by lactate level. If lactate is decreased, yes, thank you, dear. Lactate level is decreased, then it is, yes, pyruvate kinase. If lactate level is increased, this is G6P deficiency. Okay, now in G6P deficiency, this is X-linked. So more common in male than female, and hemolysis is precipitated by antimalarials. Although you have discussed all these things with pathology, but just to point out, okay, fava beans, very good, fava beans. Now, so these are the important points which are frequently asked. Now, Rappaport Lubring cycle recently asked topic multiple time in our FMG and also in I9 and NEAT. So important. Rappaport Lubring cycle occur in RBC. No net gain of ATP in Rappaport Lubring cycle. So this is RBC. Shape is little bit distorted, but okay, ठीक है, चलेगा. Yes, we found that in RBC, glucose is ultimately converted to lactate, anaerobic glycolysis, and anaerobic glycolysis net gain 2 ATP. Anaerobic glycolysis net gain 2 ATP. Now we found that in RBC, this glycolysis is continuing like this. 1,3-biphosphoglycerate is converted to 2,3-biphosphoglycerate. 1,3-biphosphoglycerate is converted to 2,3-biphosphoglycerate, that is by mutase. Okay, 2,3-biphosphoglycerate और 2,3-DPG, नाम तो सुना ही होगा. फिजियोलॉजी में काम क्या है इसका? हीमोग्लोबिन. This is hemoglobin. 2 alpha globin chain, 2 beta globin chain, hemoglobin. We found that each globin chain can bind to 1 molecule of oxygen. So 4 globin chain bind to 4 molecule of oxygen. Now 2,3-DPG came. 2,3-DPG has affinity for beta globin chain. So it will bind to this beta globin chain. You can remember very easily, just like suppose when you were small, means kids, or better to say teenager, 10 plus 2, a small bench, 4 students already sitting, tuition padhne gaye, and teacher said so much of space. Anyhow, you entered between two of them, little bit space. Anyhow, you entered. After that, you started doing like this. Tuck, one bahar. So O2 is gone. So after joining to this beta globin chain, it caused tort state. टोट स्टेट एक क्वेश्चन भी आया हुआ बच्चे, फिजियोलॉजी में पढ़ा होगा तुमने, बट दे टोट तो हो जाएगी, है ना? यस, 2,3 bind to beta globin chain. This question has been asked. It has affinity for beta globin chain. Yes. So remove O2 and shift O2 decision curve towards right. Yes. Now this 2,3-DPG again converted to 3-phosphoglycerate. I will not calculate number of ATP. Simply remember in Rappaport Lubric cycle, no net gain of ATP. Now, one important point is there, which has been asked in NEAT, not in our FMG, but they can. Same question can be repeated. What question was asked? Let me tell you. This phosphofructokinase, in Rappaport Lubric cycle, this pathway is diverted like this. So this step is bypassed. So they ask that in which enzyme deficiency, hexokinase, Option B, phosphatokinase. Option C, phosphoglycerate kinase. In which enzyme deficiency 2,3-biphosphoglycerate will be increased? So if this enzyme is deficient, then 1,3-biphosphoglycerate will not be converted to this. It must enter this pathway. So 2,3-biphosphoglycerate will increase. Got the point? So this question has been asked in our NEET on Rappaport looping cycle. So we know all the question on this topic. Now this is favorite topic. Every time we found that pyruvate enter the mitochondria. Whosoever enter the mitochondria is oxidized. So this pyruvate was little bit hesitant. I will not enter mitochondria. Now he met to HIN, naughty boy. Yes, कहाँ चल चलते हैं देखी जाएगी है ना, जो गंदे बच्चे होते हैं ना वो गलत जगह ले जाते हैं. So now this pyruvate enter the mitochondria with the help of HIN symport. Yes, दोनों के दोनों अंदर चले गए. Yes, question has been asked that pyruvate enter the mitochondria with HN symport. HN is also called proton. P4 pyruvate, P4 proton. P4 pyruvate, P4 proton. Okay, with the help of proton or HN symport. Now, pyruvate is having 3 carbon. Pyruvate is having how many carbon? 3 carbon. Acetyl coenzyme में acetic acid, how many carbon? 2 carbon. So a 3 carbon compound is converted to 2 carbon compound. When a 3 carbon compound is converted to 2 carbon compound, 1 carbon must be removed. Removal of carbon dioxide is called decarboxylation. In this reaction, the name of enzyme is pyruvate dehydrogenase or pyruvate dehydrogenase complex. Dehydrogenase means removal of hydrogen, and removal of hydrogen is called oxidation. So removal of hydrogen is oxidation, and this hydrogen is taken up by NAD to form NADH. So we found that in this reaction there is removal of hydrogen means oxidation, removal of carbon dioxide means decarboxylation. So this is example of oxidative decarboxylation, and cofactor for oxidative decarboxylation is yes, please do comment. Vitamin B1, thiamine, vitamin B1. Okay. And you will remember the complete statement oxidative decarboxylation of alpha keto acid. Alpha keto acid is thiamine, vitamin B1. Okay. Yes. Now, if this pyruvate dehydrogenase enzyme is deficient, congenitally deficient, enzyme is not there in the patient, then this reaction would not occur. When this reaction would not occur, pyruvate will accumulate. So further pyruvate will not enter the mitochondria, and this pyruvate will be converted to lactate, 2-pyruvate to 2-lactate by lactate dehydrogenase. Lactate increases lactic acidosis. Lactic acidosis. So congenital lactic acidosis. So pyruvate dehydrogenase deficiency lead to congenital lactic acidosis. One question. Second question. In our FMG, they have asked the site of this LDH. It is present in cytosol or mitochondria. Yes, this is mitochondria. Outside the mitochondria is cytosol. So simply, it is present in cytosol. Yes, question has been asked. So pyruvate enter mitochondria with the help of HN symport. Yes. Pyruvate dehydrogenase catalyze oxidative decarboxylation. Oxidative decarboxylation, and cofactor for pyruvate dehydrogenase vitamin B1 or thiamine. So if thiamine is deficient, this enzyme will not work. If thiamine is deficient, this enzyme will not work. Again, there would be lactic acidosis. So thiamine deficiency also cause lactic acidosis. Okay, also cause lactic acidosis. So which vitamin deficiency cause lactic acidosis? And the answer is yes, thiamine. This is recently asked question in our FMG. Thiamine deficiency cause lactic acidosis. Now, citric acid cycle, TCA cycle. You all know that acetyl coenzyme may enter TCA cycle T4 TCA T410. TCA cycle produce 10 ATP. One acetyl coenzyme may enter TCA cycle to produce 10 ATPs. Okay. In this, few inhibitors are asked, just like fluoroacetate inhibit aconitase. I do remember it as acro, fly, flu or fly. So little bit idea you will have. We will have fluoroacetate inhibit acro. Okay, aconitase. Now in this reaction, you can see that CO2 is removed just before and after alpha ketoglutarate. Yes, CO2 is removed just before and after alpha ketoglutarate. This question has been asked. CO2 is removed just before and after alpha ketoglutarate. This question has been asked. Now, this succinate dehydrogenase is important. Succinate dehydrogenase produce FADH. Most of the places, whenever you find dehydrogenase, just like malate dehydrogenase, alpha ketoglutarate dehydrogenase, isocitrate dehydrogenase, we find NADH, 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 pyruvate dehydrogenase, NADH. There are only few places where dehydrogenase produce FADH. That's why question is asked. So they ask question, which of the following dehydrogenase produce FADH? So succinate dehydrogenase produce FADH. Yes. Now, this malonate inhibit succinate dehydrogenase. Malonate inhibit succinate dehydrogenase. Mnemonic is माल, माला नहीं। पहले मैं इसको निमोनिक बनाया था हमने माला सक फक। अब थोड़ा सा मॉडिफाई किया है, माल कर दिया हमने। क्यों? क्योंकि माला से मैलेट कंफ्यूज हो जाएंगे हम। मैलेट is having 4 carbon, malonate is having 3 carbon. Yes, watermelon, 3 looks like watermelon, तो माल अपने आप ही बनते हैं निमोनिक, मैं तो बनाता नहीं। हाँ, मेलोनी कर दो। हाँ, मेलोनी। ओ तेरी। हम्म, अब मोदी जी को बीच में मत ले आना, है ना? ठीक है। नॉटी बॉयज। ओके, मेलोनी is succinate dehydrogenase, FADH. Yes, malonate inhibits succinate dehydrogenase and it produce succinate dehydrogenase produce FADH. मेलोडी करेंगे इसको, है ना? सॉरी, हम किसी पे कमेंट नहीं कर सकते, उसके लिए हम सॉरी बोलते हैं। ठीक है, मेलोडी करेंगे इसको। ठीक है, चलो। यस। ओके। हाँ, यूट्यूब पे चल रहा है, तो यूट्यूब पे चल रहा है। ओ, सॉरी सॉरी, है ना? ऐसे कर लेते हैं, है ना? ठीक है। फिर बहुत है नाम, है ना? हमने पूरा नाम थोड़ी लिया है, डरते नहीं, देखी जाएगी जो होगा। ठीक है, क्या कहा मैंने? जो होगा देखी जाएगी, डरना नहीं है। नोट फॉर दिस थिंग, ऑल्सो फॉर आवर एग्जाम। यस, इन आवर एग्जाम वी विल फाइंड फ्यू डिफिकल्ट क्वेश्चन। सो उस टाइम पे डरना नहीं है। क्या याद रखेंगे? कैसे याद रखोगे तुम? कि यूजुअली मैं कहता हूं, यदि कभी डर लगे तो तुम सोचना मेरे दोस्त मगलू का क्या होगा। मैं तो फिर भी लगातार पढ़ रहा हूं, मगलू ने तो बहुत दिन से पढ़ाई नहीं की, है ना? बड़ा डिफिकल्ट पेपर आया है, मगलू का तो गया आपसे, है ना? यस। ओके, चलो। तो हमने वापस आ जाते हैं अपने दुनिया में। ओके, रैबिट स्माइल। इलेक्ट्रॉन ट्रांसपोर्ट चेन। electron transport chain, we found that complex 5, complex 1, 2, 3, complex 1. Okay. Definitely, I will tell you in the last. Okay. Yes. Complex 1, complex third, complex 4. Coenzyme Q, cytochrome C. We found that, we found that name of complex 1 is NADH coenzyme Q reductase. This point is important. Yes. This question was asked. This question was asked in NEET PG. What is the function of this complex 1? This topic is really, really important. The reason this question has been asked in INI May. If you remember when we discussed this topic in our main class, I told you that every time they are asking the same topic and in a different way, trying to confuse you. So we will discuss that part also. But before that, yes, a question which has been asked previously, we found that NADH produced 2.5 ATP. Yes, NADH produced 2.5 ATP. How it produced? We found that complex 1 take hydrogen from NADH and give to coenzyme Q. Removal of hydrogen is called dehydrogenation. So complex 1 can be called as NADH dehydrogenase. So they ask inhibitor of complex 1. They ask inhibitor of complex 1. Okay. And yes, they asked inhibitor of complex 1 and in option they gave NADH dehydrogenase. What they gave? NADH dehydrogenase. Okay. So means in place of complex 1, the name was given in the question. Yes. Now complex third take hydrogen from coenzyme Q and give to cytochrome C. Cytochrome C is reduced. That's why complex third is called cytochrome C reductase. Complex 4 take hydrogen from cytochrome C and give to oxygen. That's why complex 4 is called cytochrome C oxidase. And last acceptor of hydrogen is, yes, oxygen. This question has been asked. Okay. Now, we found that when this H atom is moving, H atom, at the same time, H atom and H ion are different, are transferred from mitochondrial matrix to intermembrane space. Complex third transfer 4 ion, complex 4 transfer 2 ion. So NADH transfer 4, 4, 2, 10 ion. These 10 ion accumulate in intermembrane space. These 10 ion want to go back in mitochondrial matrix. And there is complex 5 for that. We found that when 4 ion pass through this complex 5, 1 ADP is converted to 1 ATP. 1 ADP is converted to 1 ATP. This is called, yes, oxidative phosphorylation. So, if, yes, this is coupling. 4 ion pass through this complex 5, they are coupled with ATP production. They are coupled with ATP production. If you do what you did, 2,4-dinitrophenol, you gave 2,4-dinitrophenol. Dinitrophenol, phenol produce whole. Phenol produce whole. So we found that 4 ion, 4 ion, 4 ion, 2 ion. So these ion have two options, either go via this or go via this pore, hole. तो कहां से प्रेफर करोगे? यस, लैग ज्यादा हो रहा है या ठीक चल रहा है? कहां से? यस, कहां से एंटर करोगे? यस, यू विल एंटर द होल। या नहीं? Okay, yes, 2,5,4-dinitrophenol produce whole, and yes, when this ion enter via this hole, energy is released as heat. Heat निकलती है, तुम्हें पता है। So energy is released as heat. Okay, so यही क्वेश्चन तुम सोल्व कर सकते हो. दिस इज अनकपलर. सो दे आस्क अनकपलर. Yes, when these 4HN produce go via this, they produce ATP. When they go via this, that energy is not going to produce ATP. Energy is released as heat. Okay, so you can solve this question. Decrease ATP, decrease ATP production. Yes, so you can rule out option A and C. And energy is released as heat, so increase body temperature, not decrease body temperature. So answer is B. Increase oxygen consumption. Yes, oxygen consumption would be increased. Why oxygen consumption would be increased? Because body will try to produce ATP. So more and more NADH will come and will produce this gradient and more HN. Yes, yes, will be transferred, and in this transfer this H2 is produced. So even if you don't remember, yes, you can solve the question by concept only. Yes, uncoupler, any compound which cause HN leakage at inner mitochondrial membrane, that is uncoupler. Yes. Okay, 2,4 and 4 dinitrophenols, high dose aspirin, thermogenin found in brown fat, responsible for known shivering thermogenesis. Yes. Thyroxine, long chain fatty acid, unconjugated bilirubin, bill, whole. बिल भी तो whole ही होता है, सांप का बिल. Now we come to hmm, yes, other questions which has been asked previously. This is ADP ATP translocase is inhibited by atractyloside. So A for ADP ATP translocase TRA tractyloside. You can easily remember ADP ATP translocase is inhibited by atractyloside. Okay. Now complex 5 FO unit. FO unit or F0 unit is inhibited by oligomycin. Yes, this FO is HN channel. If you ligate this channel, yes, ligate this channel. If you ligate this channel, तो it will be inhibited. So नाम ही तो अपना बता रहा है, O को ligate किया, O is ligated. Yes, so oligomycin inhibit FO portion of complex 5. Now inhibitors directly question ask complex 1 inhibited by rotenone ONE1. Yes, 26 के क्वेश्चन आए नहीं कि मैंने सारे इसमें रखे हैं क्वेश्चन पेपर इसमें डिस्कशन में. ओके, नो नीड टू वरी. तुमसे ज्यादा चिंता मुझे है. आई एम रियली वर्क कि तुम्हारे सारे क्वेश्चन हो जाए विद very easily. I know that you will clear this exam. Okay, the only thing I want from your side, the positive attitude. Yes, you have really worked hard. If you have really worked hard, nobody can stop you to clear this exam. I assure you. It's my personal experience. Yes, कि जिसने बच्चे ने मेहनत की है उसका एग्जाम क्लियर होगा. Yes, the only thing you require the confidence in your hard work, and definitely we will remain till last. This is the purpose of this marathon. Okay, now we come back to complex 1 phenobarbitone ONE1 amobarbital. A for alphabet, first alphabet. L, aldehyde. Aldehyde is present at carbon number 1. Pyridine, A, or simply sometimes pyridine you will find. If you want to pierce ear with the help of needle, needle looks like 1. So mnemonic. Yes. Malonate, complex 2. Inhibitor malonate. Mnemonic is M as Dhoni. Malonate inhibits succinate dehydrogenase. It also inhibits complex second. Carboxin, by carbixin, bixin means then by matlab 2. TTFA, if I just add this line, yes, this looks like second, 2 complex 2 inhibitor. Okay. Antimycin, N3mycin. So I can write like this. Yes, N3mycin. Bal, British anti-leucite. How many letters? 3 letters are there. Complex third. Yes. थोड़ा सा लैग है. Let me check. Connection. Okay. Ide. Wherever you find ide, carbon monoxide, yes, cyanide, hydrogen sulfide, sodium azide. Yes, these are inhibitor of complex 4. Recently in NEET 24, they gave option nitric oxide. Okay. Yes. ओके, स्क्रीन में और आवाज में डिले है. ओके. यस, बफर है थोड़ा. चलो लेट्स सी, एक बार चेक कर लेता हूं मैं. ओके डियर. यस. सो NO, nitric oxide. Question was asked arginine. Arginine. 9. Yes, precursor for NO is arginine. Yes, arginine. 9 मतलब नो. नो हिंदी में नो कहते हैं. यस. सो क्वेश्चन हैज बीन आस्क्ड इन आवर FMG. प्रिकर्सर फॉर NO इज arginine. Now, enzyme is NO NO synthase, and this is inhibited by smoking. And NO is required for vasodilation and for penile erection. Erection has important role. So if you are smoking, definitely NO synthase would be affected, and that can lead to erectile dysfunction. So please stop this smoking, otherwise you will not remain macho man. तो macho man बनना चाहते हो तो छोड़ दो. Yes, smoking. HMP shunt. Yes. MS धोनी क्या था बच्चे? MS, M4 malonate, S4 succinate dehydrogenase. We have discussed that malonate inhibits succinate dehydrogenase. दो नहीं, दो means two, दो नहीं, टू नहीं रहेगा, complex 2 is gone. Yes. Yes, macho man will become nacho man. Very good. वो बस नाचता रह जाएगा. Nothing will be done. Yes. HMP shunt, pentose phosphate pathway. Yes. Glucose 6 phosphate is connected to 6 phosphogluconate by glucose 6 phosphate dehydrogenase rate limiting enzyme. NADPH is produced. Again, dehydrogenase NADPH is produced. This is oxidative phase. Oxidative phase. Irreversible. Irreversible. The further reactions, non-oxidative phase. Non-oxidative phase. And this is reversible. 2-3 times they have asked this question, which is reversible, which is irreversible. Yes. Okay. We found that HMP shunt is absent in non-lactating mammary gland, skin, and skeletal muscle. Question has been asked. Now we come to most important part, that is frequently asked, glycogen storage disease. Yes. We are rotated with only 3 hours, I think. Okay. Don't worry, we will try. Yes. So we'll try to cover. No need to worry. HMP शंट हमारा कंप्लीट हो जाएगा. यस. इससे दैट इज सफिशिएंट इन दिस वन इंपॉर्टेंट पॉइंट, दैट G6P deficiency, rate limiting enzyme deficiency lead to hemolytic anemia. Okay. Most common enzyme deficiency leading to hemolytic anemia. Now, glycogen storage disease, liver glycogen storage disease, and muscle glycogen storage disease, you can easily differentiate. Yes. We found that fasting hypoglycemia, hepatomegaly. In liver glycogen storage disease, there would be fasting hypoglycemia. Yes. Okay. We found that in liver, blood glucose is maintained by liver glycogen up to 16 to 18 hours. If you took food, you are in fasting state up to 16 to 18 hours, blood glucose can be maintained by liver glycogen. If liver glycogen is abnormally metabolized, you will not be able to maintain blood glucose by liver glycogen. So there would be fasting hypoglycemia. Fasting hypoglycemia. Hepatomegaly, because glycogen will not be metabolized, so it will accumulate in liver, so hepatomegaly. This glycogen is accumulated. Now, what you did biopsy. Suppose you did biopsy. In biopsy, you found that the glycogen which was accumulated has no abnormal structure. Abnormal structure. Okay. So we found that a mnemonic A, B, C, D. A for Anderson disease, branching enzyme is deficient. Cory's disease, debranching enzyme is deficient. So simple mnemonic A, B, C, D. C, third alphabet, so type 3, Anderson type 4, glycogen storage disease. So if any clinical scenario is there, if any clinical scenario is given, this question has been asked in our FMG. Okay, let me see, not put here. Anyways, they will give you clinical scenario. Let me give you. Suppose a patient is having fasting hypoglycemia, hepatomegaly is there. He is also having other symptoms, breathlessness is there, multiple things they have given. And in last, they mention that on liver biopsy, abnormal glycogen is accumulated. And they gave option, what is the diagnosis? Option A, von Gilkey's disease. Option B, Hurst disease. Option C, Cory's disease. Option D, Pompe's disease. So if they mention that abnormal glycogen is accumulated, I will not think anything, because Anderson disease not given the option. Anderson disease is not given on the option. If abnormal glycogen is there, either answer would be Anderson or Cory's. So Anderson not given the option. Answer was Cory's disease. Okay. So in any question, if abnormal glycogen word is used, and in option out of these two only one is given, you will not read the question. Directly mark the answer, because abnormal glycogen accumulate only in Anderson and Cory's disease. Cory's disease, many times we found that patient recover itself. We found that during adolescence, these symptoms resolves. So I can say Cory's, C4 Cory's, C4 cures itself. Cory's disease cures itself. And cures itself means self-limiting. अपने आप ठीक हो जाती है. So self-limiting. That's why another name, limit dextrinosis. Not that's why this is mnemonic. Limit dextrinosis, because the accumulated glycogen is named limit dextrin. Okay. So mnemonic बन गया हमारा. Cory's disease cure itself. Anderson disease, death occur up to 4 years. Name itself tells you Anderson, end of son. बेटा मर जाएगा. बेटा मर जाएगा. Death up to 5 years, although given. But here I have taken 4 years so that we will remember it, that Anderson disease is type 4. So if abnormal glycogen, without second thought, Anderson or Cory's. If normal glycogen is accumulated, it may be von Gilkey's disease or Hurst disease. In von Gilkey's disease, glucose 6 phosphatase is deficient. Question has been asked, glucose 6 phosphatase is common enzyme for glycogenolysis and gluconeogenesis. And we have learned that gluconeogenesis occur in liver and kidney. Mainly liver, some gluconeogenesis also occur in kidney. Liver is husband, kidney is wife. Okay, or boyfriend, girlfriend. Main earning member liver है, mainly liver. Some amount of gluconeogenesis is done by kidney. Suppose von Gilkey's disease is there, this glucose 6 phosphatase is deficient, and a patient present to you. Yes, or simply symptoms को हम करें. A patient in a fasting state, then liver will try to maintain blood glucose by glycogenolysis. But this enzyme is deficient, so liver will not be able to maintain blood glucose. Liver said, don't worry, I will do gluconeogenesis. I will do gluconeogenesis to maintain blood glucose. But gluconeogenesis, the last enzyme is same. So liver can't do gluconeogenesis. So liver was not able to maintain blood glucose. Then kidney shouted. Usually होता है ना, क्या कर रहा है liver? You can't maintain blood glucose. Liver said, I tried my best. Kidney became hyperactive. Yes, renomegaly. So this is the catching point. In von Gilkey's disease, there is renomegaly. Okay. तो renomegaly कहीं तुम्हें मिल जाए, glycogen storage disease, so you will think of von Gilkey's disease. In this hepatomegaly, fasting hypoglycemia, renomegaly, lactic acidosis, hyperuricemia is there, triglycerides increased. While in Hers disease, glycogen phosphorylase is deficient. In this simple symptom, fasting, hypoglycemia, hepatomegaly would be there. No other, these symptoms would not be there. Okay. Okay. Recently, when question was asked in our exam, they mentioned, yes, they mentioned about glucagon challenge test. So this topic has been touched, so you must know. We found that type 1 and type 3, you can differentiate by glucagon challenge test. In fed state, if you give glucagon, in type 1, no increase in blood glucose. In type 1, there is no increase in blood glucose. It may be fed state or fasting state, no increase in blood glucose. But in type 3, yes, in fed state, there is increase in blood glucose, but fasting state, no increase in blood glucose. So this is difference. Okay. Got the point. This is about liver glycogen storage disease. Muscle glycogen storage disease, we found that myocardial disease, muscle glycogen storage disease, sorry. The symptom is exercise intolerance. The symptom is exercise intolerance, main symptom. Okay. If muscle phosphorylase is deficient, that is myocardial disease. थोड़ा कंफ्यूज था मैं, क्या कहा मैंने, कोई बात नहीं, दोबारा देख लेते हैं. We started with muscle glycogen storage disease. In this, the symptom is exercise intolerance. Exercise intolerance, type 5 myocardial disease, muscle phosphorylase. When glycogen will not be metabolized, when you will do exercise, you will not be able to utilize muscle glycogen. So, yes, muscle cell death would occur, rhabdomyolysis would be there. Myoglobin will be released. That myoglobin appear in urine, that is burgundy color of urine. Lactate level would be decreased. Normally, whenever we do exercise, okay, normally after exercise, lactate level is increased. Anaerobic glycolysis, if start from glucose, net gain, yes, if anaerobic glycolysis start from glucose, net gain 2 ATP. But if the starting point is glycogen, then net gain 3 ATP. Question has been asked, net gain 3 ATP. Okay, clear? Now, type 2, Pompey's disease. In Pompey's disease, mnemonic of 2. We pump with two hands. We pump with two hands. तो तुम्हें याद रहेगा, ये Pompey's disease फेवरेट टॉपिक हो रखा है उनका. Yes, we pump with two hands. Hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy. Yes. So wherever you will find hypertrophic cardiomyopathy, in glycogen storage disease, that is Pompey's disease. Okay. Now, you will remember that death occurred due to heart failure, pump failure, heart failure. Okay. Approximately 2% of glycogen is degraded in lysosome by enzyme acid maltase. Okay. So, compound accumulated is glycogen, accumulate in lysosome. So, it is both glycogen storage disease and lysosomal storage disease. Accumulated compound is glycogen, so glycogen storage disease. Accumulate in, yes, lysosomal storage disease. So this question was asked in our FMG January 26. 4-month-old infant presented with hypotonia, hypertrophic cardiomyopathy, acid maltase was deficient. Direct answer, yes, Pompey's disease. That is Pompey's disease. Sometimes they will give image-based question. They will give you chest X-ray in which the cardiac shadow will be large. and they will show you floppy infant, floppy infant. Although not so much of specific, but in question you may find floppy infant, hypotonia would be there, and cardiac shadow would be large, and they will ask, yes, which glycogen storage is this? Pompey's disease. Pompey's disease. Glycogen synthase deficiencies type 0 glycogen storage disease. In liver biopsy, no glycogen. No glycogen on liver biopsy. Clear? So we have tried to cover most of the questions. Now, this topic has been asked so frequently. ब्रेक अभी नहीं मिलेगा बच्चे, ठीक है? टाइम का देखते हैं हम कि हाउ वी विल मैनेज। सर से बात करके देखते हैं एक बार, सर यदि अवेलेबल होंगे बाद में तो हम बढ़ाएंगे, अदरवाइज वी विल कवर। ओके, नो नीड टू वरी। वी फाउंड दैट ग्लाइकोजन इज लैक का कुछ करना पड़ेगा। एक बार देखना, आवाज साफ आएगी, ठीक है? ओके, यस। कोई अभी देखना, आवाज ठीक है? यस, ओके। वी फाउंड दैट glycogen is converted to glucose. Glycogen is converted to glucose by glycogen phosphorylase, glycogenolysis. Glucose joined to form glycogen synthase. We found that glucagon epinephrine increase cyclic AMP. It activate protein kinase. Protein kinase A attach phosphate to glycogen phosphorylase, attach phosphate to glycogen synthase. Few enzymes are activated by phosphorylation. Yes, few enzymes are inhibited by phosphorylation. आवाज सही है बच्चों? Yes, few enzymes are activated by phosphorylation, few enzymes are inhibited by phosphorylation. Okay, so this glycogen phosphorylase is activated by phosphorylation, glycogen synthase is inactivated by phosphorylation. Two opposite pathways are regulated in such a way when one is activated, another should be kept in inhibited state. And the simple mechanism is, if we attach phosphate to glycogen phosphorylase, it is activated. Which attached to phosphate to glycogen synthase, it is inactivated. So means you are regulating enzyme by covalent modification. As I told you earlier, this question was asked. Yes, clear? Glycogen phosphorylase is just like Thanos. Yes, how many stones were there in Thanos? Half population gone. Yes, 6 stones were there. So cofactor for glycogen phosphorylase is vitamin B6. Vitamin B6 question is asked. Okay. Yes. Now, galactose metabolism, fructose metabolism, very, very important question is asked. Point it out. Galactose normally metabolized by galactokinase, first enzyme to galactose 1 phosphate. If galactokinase is deficient, this is minor type of galactosemia. Minor type of galactosemia. This reaction would not occur. Galactose will be converted to galactitol. Galactitol, other name is dulcitol. Other name is dulcitol. And this will accumulate in lens to produce oil drop cataract. To produce oil drop cataract. Clear? So, याद कैसे रखोगे? Hey girl, your skin is dull because you are using oily cream. है ना? Advertisement आता है ना? So, only and only symptom is, yes, galactosemia. Only and only symptom is oil drop cataract. Minor type of galactosemia. If galactose 1 phosphate util transferase is deficient, this is classical galactosemia. In this step would not occur. This galactose will accumulate, will produce oil drop cataract. Classical galactosemia, oil drop cataract. Oil drop cataract would be there. Yes. This galactose 1 phosphate will accumulate. Galactose 1 phosphate inhibit glycogen phosphorylase. Yes. Yes, glycogen phosphorylase inhibit glycogen phosphorylase. So glycogen will not be broken down. So glycogen will not be broken down. So this will be leading to fasting hypoglycemia, hepatomegaly. Fasting hypoglycemia, hepatomegaly would be there. Okay. So remember, Fasting hypoglycemia, hepatomegaly, we have seen in liver glycogen storage disease. But fasting hypoglycemia, hepatomegaly, also seen in classical galactosemia. But other than that, oil drop cataract would be there, and there would be relation with milk because milk is having lactose. Lactose is made up of glucose plus galactose. So means relation with milk, 1 point. Second, oil drop cataract. Third, yes, this galactose is so large amount, it is reducing sugar. So Benedict test positive, Benedict test positive. So in classical galactosemia, minor type of galactosemia, Benedict test is positive. Okay. Now, if fructokinase is deficient, this is essential fructosuria. Patient is asymptomatic. Why? Because this reaction would not occur. Fructose will increase. This extra fructose will be excreted via urine. It will not accumulate in our body. When it will not accumulate in our body, no symptom, patient is asymptomatic. Yes, you can easily differentiate. This was galactosemia in blood. Fructose is excreted in urine. So patient is asymptomatic because extra fructose is excreted in urine. Got the point? And fructose is reducing sugar, so Benedict test positive. If aldolase B is deficient, then it is hereditary fructose intolerance. Hereditary fructose intolerance. In this reaction would not occur. Fructose 1 phosphate will accumulate. This fructose 1 phosphate again inhibit glycogen phosphorylase. Again, fasting hypoglycemia, hepatomegaly. So how you will differentiate? First of all, if galactose metabolism, fructose metabolism abnormality is there, yes, 4 disorder we have discussed, minor type of galactosemia, essential fructosuria, classical galactosemia, hereditary fructose intolerance, in all these Benedict test is positive. Benedict test is semi-quantitative test, you know. Now, this is question on Benedict test. Leave it. Now we found that in minor type of galactosemia, only symptom would be cataract. In essential fructosuria, patient is asymptomatic. Clear? Now you will differentiate between classical galactosemia and hereditary fructose intolerance. One important point, cataract in classical galactosemia, no cataract. But in many clinical question, you will not find comment on cataract. So if they don't comment on cataract, you can't exclude this galactosemia. Second point, which usually differentiate relation with breast milk and present in early life. They will present that patient presented after 2 weeks, 3 weeks, jaundice, hepatomegaly, fasting hypoglycemia. Yes, and history of breast milk would be there. But in hereditary fructose intolerance, typical, they will give you that patient would appear in OPD with parents would say that Dr. Saab, child was absolutely okay till 4 months, 6 months, exclusive breastfeeding for 6 months. After 6 months, these symptoms developed. Yes, now these symptoms developed after 6 months. When you started weaning, you gave fruit juice, है ना? जब fruit juice दिया तो फ्रक्टोज आया, फ्रक्टोज आएगा तो symptoms आएंगे. ओके, दादाजी ने खिला दिया फ्रूट, है ना, 4 महीने पे, तो 4 महीने पे आ जाएगा, है ना? पोते को थोड़ा स्ट्रॉन्ग बनाना था ना. यस, सो रिलेशन विथ फ्रूट जूस, symptoms start around 4 to 6 months when we start weaning. So many times you will find that they will give you catching point, the starting of symptoms early in life, classical galactosemia. Yes, 4 to 6 months, hereditary fructose intolerance. And in classical galactosemia, this question was asked in January 23, absolute contraindication for breastfeeding, this classical galactosemia. Sorbitol pathway, you all know. Yes, sorbitol. Glucose is converted to sorbitol. Sorbitol is converted to fructose. And you know, fructose is sweeter than glucose. तुम्हें पता है fructose is sweeter than glucose. और हनी में भी fructose होता है. हनी में भी क्या होता है? Fructose होता है. Yes, yes, naughty boys. So fructose is sweeter. हनी तुम ये कैसे याद रखोगे? यू विल फॉरगेट, आई नो दैट. थोड़ा सा मजा तो होना चाहिए लाइफ में, बिकॉज टिल लास्ट वी विल एंजॉय, टिल एग्जाम you should enjoy, have confidence, you have really worked hard, okay, and you will remain positive, you will smile, Okay, if you will remain happy, your performance will increase. Okay, परफॉर्मेंस मैटर करती है, ठीक है। तो परफॉर्मेंस बढ़ानी है हमने, तो बच्चों तुम्हें पता है वी से आवर गर्लफ्रेंड और बॉयफ्रेंड और वाइफ और हस्बैंड, hey honey, we don't say glue glue because we know that honey is having fructose and fructose is sweeter than glucose. Fructose is sweeter than glucose. Hey honey, huh? Yes. Chalo. So we found that normally in our body, glucose can be converted to fructose by this sorbitol pathway. This pathway normally occur in seminal vesicle. As you know, seminal fluid is rich in fructose. Okay. We found that in diabetes, more and more glucose enter sorbitol pathway, and this sorbitol accumulate in lens to produce snowflake cataract. To produce snowflake cataract. This question was asked. Okay. Now, glucose transporter 2, glucose transporter 2, this is question of our FMG, is present at mnemonic is lip kiss. दो बंदे, दो लिप्स, कैसे भी मान लेते हैं, लीवर, intestine, pancreas, kidney, glucose transporter 2. Question was asked that this glucose transporter 2 is present at contraluminal or basolateral side. तो कॉन्ट्राल्यूमिनल आया है हमारे एफएमजी में, दूसरी तरफ, ल्यूमन की दूसरी तरफ। यस, ल्यूमन है ये, कॉन्ट्राल्यूमिनल। यस, सो दूसरी तरफ, हाँ? दूसरी जगह, ठीक है। नाउ वी फाउंड दैट glucose transporter 4 are present, yes, skeletal muscle, yes, heart, adipose tissue. Heart is having 4 chambers, so glucose transporter 4. Heart is having how many chambers? Glucose transporter. Yes, 4 याद रहेंगे हमारा. Yes, Popeye the cell of the muscular man, when she looked at her heart started beating thuk 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 after marriage. So much of good food, now having adipose tissue, so much of adipose tissue. Random mnemonic, story mnemonic हमने बना लिया, but we will remember. Yes, okay. Yes. So 4 chambers heart में होता है, glucose transporter 4, skeletal muscle and adipose tissue, glucose transporter 4. Insulin increases the concentration of glucose transporter 4 at heart, skeletal muscle, and yes, adipose tissue. But they have asked question, yes, they have asked question multiple times by changing the language. After overnight fasting, insulin will decrease. Insulin increases the concentration of glucose transporter 4. So when fasting, insulin decreases. So glucose transporter 4 concentration decreases at heart, skeletal muscle, and adipose tissue. Clear? So these are questions. Now we come to fatty acids. Omega-3 fatty acid. Omega-3 fatty acid, mnemonic is CAT, C-A-T, CAT. Carbonic acid, alpha-linolenic acid, timnodonic acid. We found that omega-3 fatty acids are cardioprotective. These are cardioprotective. Yes, A, B, C. C for cardioprotective. Third alphabet is C. So cardioprotective, you will remember note, they can ask you question between omega-3 and omega-6. So omega-3 are cardioprotective. Omega-6 example, gamma-linolenic acid, arachidonic acid, linoleic acid. Yes, so you will remember. In this question has been asked. We have little bit idea about the example of omega-3 and omega-6. This is favorite question, favorite topic. Okay. Fatty acid synthesis in fat state. In fat state, I took glucose, carbohydrate, 60-70% of our diet is carbohydrate. So what happened? Glucose is coming to pyruvate. Pyruvate enter the mitochondria. This is mitochondria. Pyruvate is going to acetyl coenzyme. Acetyl coenzyme enter Krebs cycle to produce 10 ATP. But when energy requirement of cell is fulfilled, Extra acetyl coenzyme is converted to citrate. Citrate come out of the mitochondria. This is called citrate shuttle. Citrate shuttle. So this question has been asked. So in fatty acid synthesis, citrate shuttle would be activated or inhibited. Please do comment. Yes, in fatty acid synthesis or fat state, when you are converting extra carbohydrate to fat, so at that time citrate shuttle would be activated or inhibited. Activated. This question in NEET. लेकिन एफएमजी में आ सकता है हमारे. ओके, साइट्रेट कैन बी साइट्रेट इज फर्दर कमिंग टू एसिटाइल कोएंजाइम and oxaloacetate. I am not discussing this in detail. Acetyl coenzyme A, 2 carbon is converted to malonyl coenzyme A, 3 carbon. When 2 carbon compound is converted to 3 carbon compound, 1 carbon must be joined. Joining of carbon dioxide is called carboxylation. Carboxylation. Yes. So कार बॉक्स में क्या होता है? कार के बॉक्स में क्या होता है? एक्सीलेटर, ब्रेक एंड क्लच. ABC. Accelerator, brake and clutch. ATP, biotin, and CO2 is joined. So name of enzyme is acetyl coenzyme A carboxylase. Acetyl coenzyme A carboxylase. This is rate limiting enzyme for fatty acid synthesis. Other name for the same enzyme is malonyl coenzyme A. Malonyl coenzyme synthetase. Synthetase ATP is used. Synthase, no ATP used. Synthetase ATP is used. You can easily remember synthase. कोई pressure नहीं पड़ा. Synthetase, even in pronunciation you require a little bit more energy. So synthetase ATP is used. Yes, very good. So this is fatty acid synthesis. They ask question that in fat state when extra carbohydrate is converted to fat, yes, which of the following are activated? Citrate shuttle is activated, correct. Acetyl coenzyme carboxylase is activated, correct. Malonyl coenzyme synthesis is increased, yes, correct. So this question was recently asked. Okay. Now we come to beta oxidation of fatty acid. Very important. Yes. Hope you are enjoying the session. I know that we are having so many slides left, but we will continue. Citrate. This acetyl coenzyme may come out of the mitochondria in the form of citrate. This is called citrate shuttle. जैसे शटल चलती है गाड़ी है, ट्रेन्स को कहते हैं शटल. ओके, इन द सेम वे ये शटल कैरी द एसिटाइल कोएंजाइम. ओके. Beta oxidation of fatty acid, we found that fatty acid, palmitic acid, most common fatty acid synthesized is palmitic acid. Palmitic acid. Yes, most common fatty acid synthesized is palmitic acid, and most common fatty acid oxidized is also palmitic acid. And in palmitic acid, yes, how many carbon atoms are there? 16 carbon atoms are there. So question is asked, complete oxidation. Yes, complete oxidation of palmitic acid, net gain of ATP. O for oxidation. If I put O between this 1 and 6, 106, 106 ATP. 106 ATP. Yes. थोड़ी देर में बस 10 मिनट में ब्रेक देंगे. ओके, 10 मिनट बाद 10 मिनट का ब्रेक देंगे. यस, ये फैटी एसिड वाला कंप्लीट कर लिया. Complete oxidation of palmitic acid, net gain 106 ATP. Yes, we found that beta oxidation of fatty acid. Yes, we know that palmitic acid is having 16 carbon atom, and if we want to do beta oxidation, this must enter the mitochondria. So first of all, we activated fatty acid. This fatty acid is going to acyl coenzyme A. Acyl coenzyme A, and this activation required 2 ATP. 2 ATP used. Just like if you ask somebody to sacrifice और कुछ काम करने के लिए कहा, यार वहां पे मजबूरी में चला जा तू काम करने के लिए, you will give some, mountain dew दे दी तुमने. Yes, acyl coenzyme fatty acid knows that when I will enter the mitochondria I will be oxidized. तो तुमने क्या किया? Mountain dew. Yes, 2 ATP खर्च किए, डर के आगे जीत है. Go and yes, produce energy. So after taking this 2 ATP, या 2 पैग लगाने के बाद यू आस्क योर फ्रेंड, बता भाई क्या काम है। 2 पैग लगाने के बाद ये तो होता है, भाई क्या काम है। यू आस्क, यू हैव टू एंटर द माइटोकॉन्ड्रिया, फैटी एसिड palmitic acid want to enter the mitochondria, but inner mitochondrial membrane don't allow each and every compound to enter. So this as fatty acid can't enter mitochondria. Now it will take car carnitine, car of James Bond, कार ऑफ जेम्स बॉन्ड। और 2 पैग लगाने के बाद डायलॉग तुम्हें याद है, कार तेरा भाई चलाएगा, कार तेरा भाई चलाएगा। सो विद द हेल्प ऑफ carnitine, yes, fatty acid enter the mitochondria, transport of fatty acid to mitochondria with the help of this carnitine. Other than carnitine, yes, we found that CPT1, this enzyme is also required. CPT1, rate limiting enzyme of beta oxidation. Yes, very good. So fatty acid will enter the mitochondria with the help of carnitine and CPT1. Now beta oxidation will take place in mitochondria. When beta oxidation will take place, a cut is done between C1, C2 and C3. This cut, cleavage is done between C2 and C3. I use, yes, whenever you will find in test book, they will say cleavage is done between C2 and C3. But whenever I used to teach, every time students start smiling, cleavage. So I started saying, okay, cut. This cut is done with the help of these 3 enzymes: dehydrogenase, hydratase, dehydrogenase, and the last enzyme is thiolase. Yes, so this cut is done by 4 enzymes, and 2 carbon unit is released as acetyl coenzyme A. 2 carbon unit is released as acetyl coenzyme A. Now you will remember, I know we have less time, but ये वाला एनिमेशन में रोक नहीं पाता अपने आप को। यस, हाउ बीटा ऑक्सीडेशन अकर। यस, फर्स्ट डिहाइड्रोजिनेस फाड़ना है। यस, FADH, so F4 first, F4 FAD. Yes, so hydrogen is removed, taken by FAE to form FADH. Then it found it is very hard, थोड़ा हार्ड है। यस, पानी डालना पड़ेगा। यस, अपने को क्या, अपने को पानी निकालना है। हाइड्रेटेज, हाइड्रेटेज। Now again dehydrogenase, again dehydrogenase, NADH. Now thiolase, थाई पे लात लात मारी, thiolase, थाई और लात, लास्ट एंजाइम thiolase. Yes, okay, got the point. So first dehydrogenase produce FADH. Yes, hydratase join water. Second dehydrogenase produce NADH, and thiolase thiolat, है ना। So sequence question is asked. Yes, question is asked that what is the sequence of enzyme dehydrogenase, hydratase, dehydrogenase, and thiolase. Okay. This acetyl coenzyme, what is the fate of this acetyl coenzyme? Acetyl coenzyme enter Krebs cycle to produce 10 ATP. This acetyl coenzyme activate pyruvate carboxylase. This is the first enzyme of gluconeogenesis. Gluconeogenesis means it produce glucose. Yes. This acetyl coenzyme take part in ketone body synthesis. Ketone body synthesis. Yes, ketone body acetate, first ketone body to be synthesized. So 3 function of this acetyl coenzyme. One is energy production. Second is activation of pyruvate carboxylase. Activation of pyruvate carboxylase start gluconeogenesis. Third is take part in ketone body synthesis. Now, if beta oxidation is defective, if beta oxidation is defective, if this beta oxidation is defective due to any reason, this acetyl coenzyme will not be produced. So gluconeogenesis will not occur. Gluconeogenesis will not occur. So patient will present with hypoglycemia. Hypoglycemia many times present with seizures. Seizures. Acetyl coenzyme is not there. So ketone body will not be there. So decrease ketone bodies. So this question was asked recently in 24, I think, FMGE. This medium chain acyl coenzyme dehydrogenase deficiency means this dehydrogenase deficiency, enzyme deficiency, what will the effect? Beta oxidation of fatty acid would be inhibited. So hypoglycemia, decreased ketone body, and the one point was there, yes, dicarboxylic acidosis also seen. So although even if you don't remember this, you will remember by looking at the question, hypoglycemia, decreased ketone body, yes, patient present with seizures, that may be medium chain alcoenzyme dehydrogenase deficiency. One question has been asked on carnitine deficiency, CAR. Carnitine deficiency, we found that long chain fatty acids are re requiring this CAR. So fatty acid enter the mitochondria with the help of CAR. These are long chain fatty acid. Medium chain fatty acid can enter without CAR. छोटे से हैं, घुस जाते हैं कहीं भी. Yes, small chain fatty acid can enter without CAR. Yes, so we found that carnitine deficiency, if carnitine is deficient, long chain fatty acid will not be utilized. So it will bind with glycerol to form triacyl glycerol or triglyceride with long chain fatty acid. It will accumulate in muscle. So exercise intolerance, muscle cramp, muscle biopsy shows fat vacuole. Okay, so this question was asked. In this, the catching point was long chain fatty acid, triglyceride with long chain fatty acid accumulated in muscle. Because we know that long chain fatty acid require carnitine. So answer, carnitine deficiency. Clear? Now, liver is the organ which can synthesize ketone body but can't utilize ketone body due to deficiency of thiophorase. Thiophorase. So whenever question is asked, they also give thiolase in the option. So thiolase is present in liver. Alpholase, alpho liver. Liver में तो thiolase है. नाम अपने आप बता रहा है. Thiolase is having L. Liver में है, but not in, yes, thiophorase is not present in liver. That's why I can't utilize ketone body. What is ketone bodies? Three compounds are termed as ketone body: acetoacetate, beta hydroxybutyrate, and acetone. You know very well. Rothra's test. This question has been asked. Yes. Rothra's test done for detection of ketone bodies. A positive Rathra test when purple color ring is seen at junction of two liquid. Yes. Mnemonic क्या बनाया हमने? Ketone is stone. Rothra's throw. Purple propel. स्टोन प्रोपेल थ्रो. जिनके घर शीशे के होते हैं वो पत्थर नहीं फेंकते. ओके, तो यस, सो थ्रो, स्टोन, कीटोन, प्रोपेल, पर्पल कलर. ओके, यस. So this is about, they gave image based question. They said that a patient is in on starvation, and they gave that this image, this test was positive. So this is for Rothra's test. This is Rothra's test for ketone bodies. So we can take a break for 10 minutes. Yes. 10 minutes break. Exactly 10 minutes के बाद वापस आ जाऊंगा. Okay. 45 हुए हैं, 55. 4:55 we will resume. Okay. Most common ketone body present in blood, beta hydroxybutyrate. नेम अपने आप बता रहा है बहुत सारी. बीटा हाइड्रोक्सीब्यूटारेट बहुत सारी. ओके, बिफोर बिग अमाउंट. Okay, friends, welcome back. Okay, now I will increase little bit speed. Little bit speed. If I increases, is yeah, एक minute. 1 minute. Yes, if I increase, definitely it would be covered in a given time. Let's see. Yes. Refsum disease. In refsum disease, there is enzyme deficiency, phytenyl coenzyme oxidase or hydroxylase. Okay. That lead to defect in alpha oxidation of phytanic acid. That is branch chain fatty acid. Okay. Increase phytanic acid. And in refsum disease, patient present with R4 refsum, R4 retinitis pigmentosa, I4 ichthyosis, E4 E की जगह I लिखा हमने ichthyosis, fibrillation, atrial fibrillation और arrhythmias. In the question recently asked, they gave ichthyosis, retinitis pigmentosa, phytanic acid increased. The answer was refsum disease. Answer was yes, refsum disease. Now, Zellweger syndrome. In Zellweger syndrome, cerebrohepatorenal name itself tells you seizures, hypotonia, and frequently these symptoms are asked in question. Yes, functional deficiency of peroxisome. In peroxisome, very long chain fatty acid, beta oxidation of very long chain fatty acid occur in peroxisome. So when peroxisomal functional deficiency is there, then very long chain fatty acid will not be oxidized. So increase very long chain fatty acid lab diagnosis. So most of time you will find a question by this only. Okay. These are single liners which has been asked previously multiple times. Phospholipids, on which questions are asked. Phosphatidylserine, marker of apoptosis. Yes, program cell death. सर कलम कर दिया सेरीन, सर कलम कर दिया और एपोप्टोसिस निमोनिक. फॉस्फेटिडिल खोलीन, खोल के रखता है. यस. लेसिथिन, खोल के लंग को खोल के रखता है. दैट इज surfactant, component of surfactant. Yes, L4 lecithin, L4 lung. खोल के रखेगा alveoli को. And if this lecithin is defective, then it lead to respiratory distress syndrome. Okay, deficiency lead to respiratory distress syndrome. Cardiolipin, in for it is present at inner mitochondrial membrane. It is present at inner mitochondrial membrane. It is antigenic. Question. Defect in cardiolipin lead to Bath syndrome, or in Bath syndrome there is defect in cardiolipin, and patient present with cardiomyopathy. Mnemonic bar car. Yes, bar car. Okay. Cardiolipin in for inner mitochondrial membrane. Glycolipid. Question is asked on glycolipid. Yes. Question is asked on glycolipid. GM1 ganglioside. It is receptor for cholatoxin. Okay. Receptor for cholatoxin in intestine. This has been asked in our exam. Okay, dear friends. Now, this recently asked question in INI. Hypertriglyceridemia is seen in all of the following except. Yes, in this direct answer you can find if you have heard about A beta lipoproteinemia. Let me discuss A beta lipoproteinemia. Okay. A beta name itself as a mnemonic. A for apo, B for B. Defect in the ApoB containing lipoproteins. Means, chylomicron is having ApoB48. VLDL is having ApoB100. So both VLDL, chylomicron, these are absent or decreased. So this is hypolipoproteinemia. Hypolipoproteinemia. Lipoproteinemia. In this, hypertriglyceridemia would not be there. Triglyceride would be less. Okay. So high fructose diet, type 2 diabetes, nephrotic syndrome can lead to hypertriglyceridemia. Now, hyperlipoproteinemia, question, frequently asked question. We found that chylomicron contain ApoB48. Normally, this chylomicron is converted to chylomicron remnant by lipoprotein lipase. A question is asked, ApoC2 is activator of lipoprotein lipase. ApoC2 is activator of lipoprotein lipase. So lipoprotein lipase metabolize chylomicron to chylomicron remnant. If lipoprotein lipase is defective or ApoC2 is defective, in both cases, lipoprotein lipase defective or ApoC2 defective, in both cases, this metabolism will not occur, chylomicron will increase. And this is called type 1 hyperlipoproteinemia. This is called type 1 hyperlipoproteinemia, hyperlipoproteinemia type 1. In this, defect is lipoprotein lipase or ApoC2. In this, chylomicron will not be metabolized, so chylomicron will increase. That's why it is called familial hyperchylomicronemia. Familial hyperchylomicronemia. Chylomicron increases. We found that VLDL also metabolized by lipoprotein lipase. So VLDL also increases. VLDL also increases. Chylomicron VLDL contain mainly triglycerides, so triglyceride increases, cholesterol remains normal. When triglyceride increases, are you getting speed is okay? Please do comment. Yes. When triglyceride is increased, that triglyceride is white in color. Yes, white in color. So we found that milky white plasma. In question, you will find type 1 hyperlipoproteinemia, milky white plasma, or cream of tomato soup appearance. Blood is red. Tomato soup is also red. Cream is white. Triglyceride is also white. So cream of tomato soup appearance, milky white plasma, or sample kept at 4 degrees centigrade overnight. There is supernatant layer of white color. Yes, 1 मिनट का टाइम देना मुझे. Just हाँ सर. हाँ भाई. सॉरी, एक बार बात कर रहा था कि थोड़ा एक्सटेंड कर सकते हैं हम क्लास। ओके, तो वी विल ट्राई टू कवर अप टू 6:30। ओके, यस, ऑल वेल यार। नेक्स्ट, so we found that in if triglycerides are increased, that is eruptive xanthoma, okay. Yes, familial hypercholesterolemia, look at the screen. We found that LDL is having mainly cholesterol, and it is having ApoB100. Liver take LDL with the help of LDL receptor. Liver take LDL with the help of LDL receptor. Okay, and LDL receptor bind with ApoB100. So if any defect in LDL receptor or ApoB100, LDL will not be taken up by liver, LDL will increase. That is type 2A. Type 2A hyperlipoproteinemia or familial hypercholesterolemia. In this, LDL receptor is defective or ApoB100 is defective. In this, LDL will increase. LDL contain mainly cholesterol. Cholesterol increases, triglyceride normal. And whenever cholesterol increases, it lead to tendon xanthoma or tuberous xanthoma. Most common site is tendoachilles. Yes, eruptive xanthoma, triglyceride, tendon xanthoma, cholesterol. Now, we found that remnant, VLDL remnant, chylomicron remnant are taken up with the help of ApoE. With the help of ApoE, question is asked, direct question. Remnant are taken with the help of ApoE. Okay, so we found that if ApoE is defective, remnant will not be metabolized. So type 3, 3 itself tells you E. 3 itself tells you E. So ApoE is defective. Yes, ApoE is defective. In this, remnants are increased. Chylomicron remnant, VLDL remnant, also called IDL. Remnant contain both triglyceride and cholesterol. So both cholesterol and triglyceride increase. When cholesterol increases, tuberous xanthoma. When triglyceride increases, eruptive xanthoma, tuberoeruptive xanthoma, tuberoeruptive xanthoma, or and also palmar xanthoma. How you remember? Yes, if you see your palm में हमने E बना दिया, palm में हमने क्या बना दिया, रेखाओं को E की तरह लिखने लगे, तो palmar xanthoma. So we found that type 3 ApoE is defective, required for metabolism of remnant, both cholesterol triglyceride increases, tuberoeruptive xanthoma. In chest pain in type 2A, pain abdomen, pancreatitis in type 1. Yes, why pancreatitis? Because increased triglyceride put pressure on pancreas. Increased triglyceride is risk factor for, yes, pancreatitis. Clear? Now, we found that, ये देखते हैं आप क्वेश्चन, which of the following is defective in a patient presenting with eruptive xanthoma with increased chylomicron? फटाफट आंसर दे दो, फटाफट आंसर. Yes, lipoprotein lipase. Now, Tangier disease. If you see Tang, most common flavor of Tang is orange. So if you are drinking Tang so frequently, your tonsil would become orange color tonsil. So this image based question, multiple time they have asked orange color tonsil, that is Tangier disease. Tangier's disease. In Tangier disease, what is the defect? Normally we found that from peripheral tissue, cholesterol is transferred to HDL with the help of ABCA1. ABCA1. If this is mutated, this gene is mutated, ABCA1, so cholesterol will not be transferred to HDL, HDL will decrease. This cholesterol will deposit in peripheral tissue. Cholesterol will deposit in peripheral tissue, peripheral neuropathy, hepatosplenomegaly, tonsil mein, yes, orange color tonsil. So now Tang is A1 drink. So gene defect is ABCA1, ABCA1 gene, ABCA1 gene. Okay, dear? Clear? Got the point? Now, This question was asked 25. A patient presented with orange color tonsil that is sufficient to find the answer. Tanger's disease. Okay. But they mention HDL is decreased. Yes, HDL is decreased. Triglyceride 140. Okay. What is the diagnosis? So Tanger's disease. Recently asked question. This is flow chart. This will help you to solve questions on all sphingolipidosis. Sphingolipidosis are lysosomal storage disease. All the disorders I am going to discuss now, these are lysosomal storage disease. First mnemonic is TSH. TSH. Tay-Sachs disease. T for Tay, S for sex disease, H for hexosaminidase A is deficient. Sandhoff disease. SH. SH. S for Sandhoff, H for hexosaminidase. A and B both are deficient. How you will differentiate? Sand and sand के नाम में ही and है. So A and B both are deficient. Hexosaminidase A, Tay-Sachs, A and B, Sandhoff. We found that both are classified under GM2 gangliosidosis. So Tay-Sachs disease and Sandhoff disease both are GM2 gangliosidosis. How you remember? T for 2, S for second. So GM2 gangliosidosis, second gangliosidosis. You may remember like this. We found that Tay-Sachs disease frequently asked question. Tay-Sachs disease, there are cherry red spots at macula. Neurological symptoms are there, but no hepatosplenomegaly. This question is asked. T for tiny organs. Mnemonic is T for tiny organs. Yes, tiny organs. Niemann-Pick disease. Mnemonic is neem soap. Sphingomyelinases is deficient. Sphingomyelinases deficient, तो नीम की सोप याद रखोगे. This is neem soap. Sphingomyelinases. In these symptoms are quite similar to Tay-Sachs disease. Cherry red spots are there, neurological symptoms are there, but hepatosplenomegaly is present. So whenever clinical scenario is asked, they usually confuse or they usually give the hint of hepatosplenomegaly. Mnemonic. Niemann-Pick. Pick has big. Pick big. Hepatosplenomegaly. If you are taking bath with neem soap after so long time, yes, जैसे हम लेते हैं सर्दियों में, तो you will find bubbly appearance, foamy appearance, but bubbles are not so clear as Nirma girl. Nirma girl के bubble तो बहुत अच्छे होते हैं. तुम कहोगे सर हमारे bubbles तो इतने अच्छे नहीं है. क्यों? कितने दिन बाद नहाए हो? So this will help you to identify the image base कि the bubbles are not so clear. Okay, this is yes foamy appearance, bubbly appearance. And Baba Ramdev claimed that my neem soap is so strong. Zebra lao, टंकी ले जाओ. I will wash this zebra. और सारे stripes साफ. कुछ भी hypothetical mnemonic we made and we will remember that neem and pick disease, neem soap, foamy appearance, bubbly appearance. This question has been asked in INI. Okay, recently. Aryl sulfatase A is deficient in metachromatic leukodystrophy. Mnemonic simple है. Yes, leuco मतलब white. Aerial surf. Aerial surf claimed that my surf is so strong. Multiple colored granules. एक बार ऐड आया था multiple color granules in my surf. Yes, it will make your clothes white. Aerial surf. Metachromatic leukodystrophy. Okay, you may remember like this. Gaucher disease, most frequently asked question. Yes, in this beta glucosidase or glucocerebrosidase is deficient. Question आएगा Gaucher disease. U, glucosidase. Yes, bone pain is there. Gouch, ouch, 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 bone pain. Yes, if a girl is crying, definitely you will give her tissue paper, and what she will do? Crumpled tissue paper, and then you will remember the meme. Yes, आंसू मैं पूछूं और लिपस्टिक कोई और. Yes, so crumpled tissue paper appearance, Gaucher disease, ouch, ouch, glucocerebrosidase is deficient. In this thrombocytopenia, hepatosplenomegaly would be there, but no mental retardation, no, yes, intellectual disability, no neurological symptom. Krabbe's disease, beta galactosidase deficiency. In this, galactocerebrosidase is deficient. Okay. In this globoid cell, no hepatosplenomegaly. क्रैब क्या होता है? बड़ा सूखा सा होता है, पतला सा होता है. Yes. No hepatosplenomegaly. Yes. Fabry's disease, Fabrics, ऐसे याद रखेंगे, Fabrics, X-linked recessive. All these sphingolipidosis, we are discussing sphingolipidosis. All these are autosomal recessive, but Fabry's disease is X-linked. If I extend this X, it looks like alpha galactosidase. And this fabric is so good कि पसीने नहीं आते. Hypohidrosis, angiokeratoma in Fabry's disease. Farber as barber, cutting hair of sir. Ceramidase is deficient. If cutting hair of sir since morning to evening, he would feel pain in joint pain like rheumatoid arthritis, juvenile arthritis. And if you hold scissors since morning to evening, you may develop nodule formation, so subcutaneous nodules. Okay, so Barber disease, ceramidase deficient, okay, subcutaneous nodules, joint pain like rheumatoid arthritis, and juvenile arthritis. These are the catching points. Sometime in question you will find. Before that, yes, this question was asked: patient presented with hexosaminidase deficiency. They gave hexosaminidase deficiency in, yes, GM2 gangliosidosis. Okay, so no hepatosplenomegaly means tiny organs. Tay-Sachs disease, T42, GM2 gangliosidosis. So GM2 ganglioside is accumulated. Okay. Now, all sphingolipidosis are autosomal recessive except Fabry's. Fabry's is Fabrics X-linked recessive. याद रहेगा? Now, all sphingolipidosis have mental retardation except Fabry's and Gaucher's. How you remember? Fabry's fabulous performance. Although they don't have fabulous performance, but no mental retardation. Gaucher, yes, G for Gaucher, G for genius. Although patient is not genius, but not having mental retardation. So they are related to nervous system in the same way. Cherry red spot present on retina, so you can relate it as nervous system. Okay, so Fabry's disease, Gaucher's disease, no cherry red spot. Okay, cherry red spot in Krabbe's disease. This is little bit controversial. Again, I am saying Krabbe's disease, cherry red spot may be present. So present, absent. So it may be present or absent. Okay, so याद रखना ये पॉइंट. सो प्लस माइनस लगा देंगे हम इसमें, तो कंफ्यूजन नहीं होगा. सो आई कांट मेक निमोनिक KFG for this. Okay, Fabry's and Gaucher 2. All sphingolipidosis has hepatosplenomegaly at Krabbe's. Crab, yes. Patla sa, yes. Patla sa, सूखा सा, yes. No hepatosplenomegaly. Tiny organs. Clear? Point it out. I told you this is lysosomal storage disease. These are lysosomal storage disease. Yes. Accumulation of glucocerebroside indicate dysfunction of which intracellular organ? Yes. Glucocerebroside accumulate in lysosome. Okay. Yes. जनवरी में आया है ये हमारा. A 12-year-old child present with progressive abdominal distension, anemia, thrombocytopenia. ये इमेज देखते तुम याद आ जाएगा यार. ये तो क्या है? Bone pain, ouch, Gaucher disease. Yes, crumpled tissue paper appearance. Yes. Amino acids, glycine, simplest amino acid, smallest amino acid. Yes, this portion is common to each and every amino acid, only side chain is different. Yes. So if you see this carbon, 2 valencies are occupied by H. This is smallest amino acid. You may remember like this. This is R. If this is R, this is common structure to each and every amino acid. If R is H, this is glycine. So glycine is smallest amino acid, simplest amino acid. Question: side chain H, smallest side chain, simplest amino acid, no asymmetric carbon atom, so it will not show optical or stereoisomerism. No optical, no stereoisomerism. Yes, इट कैन बी सिंथेसाइज, सो सिंपल है, जो भी चीज सिंपल है बना सकते हो. सो इट कैन बी सिंथेसाइज, सो नॉन एसेंशियल. It is polar according to Harper. We will go with Harper. Yes. Yes. Metabolic functions. Metabolic functions. This is so frequently, although single liner, लेकिन ये नीट में भी आ रहा है, आईएनआई में भी आ रहा है, और हमारे एफएमजी में भी आ रहा है. So heme synthesis. We found that glycine bind with succinyl coenzyme. Glycine bind with succinyl coenzyme to form delta amino levulinic acid. First step. Purine synthesis, glycine is used. Glutathione. Name itself tells you. Gluta means glutamate. Gluta means glutamate. Yes, gluta means glutamate. Thio having SH. Thio means having SH. Cysteine is having SH. One first amino acid is glycine. So glutathione is a tripeptide having three amino acid. Collagen synthesis, every third amino acid is glycine. Every third amino acid is glycine. Creatinine synthesis, glycine, arginine and methionine. Mnemonic is game. गेम क्रिएट करना है, बचाना नहीं है. ओके, तो तुमने गेम क्रिएट किया, ग्लाइसिन, आर्जिनिन एंड मीथियोनिन. ओके, यस. एलेनिन, most important glucogenic amino acid, most important glucogenic amino acid. Now branch chain amino acid, mnemonic is live. They are essential to live. They are essential to live. Leucine, isoleucine, valine, these are essential. First point. These are branch chain amino acid. They are metabolized by branch chain alpha keto acid dehydrogenase. Branch chain alpha keto acid dehydrogenase. If this enzyme is deficient, then it lead to maple syrup urine disease. How you remember maple as apple? और maple भी तुम्हें पता है, maple tree, you know, maple tree or apple tree, you may remember. Maple tree is having branch, so maple syrup urine disease, yes, branch chain alpha keto acid dehydrogenase. And in it, burnt sugar or maple syrup smell in urine. Yes, maple को हम apple याद रखेंगे. Yes, apple को, if you keep apple cut, if you cut apple and keep for a short time, it become little bit yellowish brownish. So वहीं से निमोनिक याद रहेगा हमारा कि in this DNPH test is done, which give yellow precipitate, brownish or yellowish precipitate. Better, actually it is yellow, but हमने relate कर लिया brown से. Okay, so DNPH टेस्ट अपने आप बता रहा है नाम, देखो ना पीला है. DNPH, देखो ना पीला है. Yes, so DNPH test, yellow precipitate. Yes, increase level of branch chain amino acid in blood and urine. So frequently asked question, they will ask you that in maple syrup urine disease, which amino acid are increased in blood, which amino acid are increased in urine. So that is branch chain amino acid, that is live, leucine, isoleucine, valine, and they are essential to live. Okay, dear. Now, most important topic. Every time they are asking question. Okay. Sulfur containing amino acid. Yes, sulfur containing amino acid. Mnemonic is sister is slow in math. Cysteine and methionine. We found that homocysteine and methionine, the only difference is methyl group. If yes, I only difference is methyl group. We found that this is methionine. This is methionine. In this methionine, if I attach adenosine, that becomes SAM, as adenosyl methionine. This is universal methyl group donor. Universal methyl group donor. Okay. We found that if I remove methyl group from methionine, it will become homocysteine. Or if I join methyl group to homocysteine, it will become methionine. So the only difference is methyl group. So we found that methionine is converted to homocysteine. Homocysteine is converted to cystathionine. Cystathionine is converted to cysteine. This is normal metabolism. In this metabolism, there is an enzyme, cystathionine beta synthase. Beta synthase. If this enzyme is deficient, then yes, it lead to classical homocystinuria. Classical homocystinuria. and cofactor for this is B6 for this enzyme. In this step would not occur, so homocysteine will increase in blood and urine. Cysteine synthesis will decrease. Cysteine synthesis decrease, so cysteine becomes essential amino acid. Question has been asked, in classical homocystinuria, cysteine becomes essential amino acid because cysteine is not synthesized. Clinical feature क्या होंगे? In homocystinuria, classical homocystinuria, clinical feature mental retardation, dislocation of lens downward and medially, skeletal deformity, towel, arachnodactyly, these symptoms would be there. But these features are also present in Marfan syndrome. In Marfan syndrome, skeletal deformity, towel, arachnodactyly are there, dislocation of lens is there, but dislocation of lens is upwards and outwards. Upwards and outwards. So how you remember? Fan of AC बाहर होता है, ऊपर होता है. Yes, split AC का fan. Yes. और whenever we do urine, homocysteine urea, तो डाउनवर्ड जाता है और मीडियली जाना चाहिए. टारगेट लगा करते हैं, है ना? Marfan syndrome, that is no mental retardation. How you remember? Marfan, marvelous performance, although no marvelous performance, they not have mental retardation. This question has been asked so many times that fibrillin 1 gene mutation in Marfan syndrome. Okay, clear? We found that homocysteine is converted to methionine by homocysteine methyltransferase. In this reaction, speed is okay? Yes, methyl B12 is converted to B12. This B12 is converted back to methyl B12 with, and in this reaction, methyl tetrahydrofolate is converted to tetrahydrofolate. Okay, methyl tetrahydrofolate is converted to tetrahydrofolate. So B12 is converted to methyl B12, in which methyl tetrahydrofolate is converted to tetrahydrofolate. If B12 is deficient, then methyl tetrahydrofolate will not be converted to tetrahydrofolate, and this phenomenon is called folate trap. So in B12 deficiency, methyl tetrahydrofolate is not converted to tetrahydrofolate. Active form of folic acid is tetrahydrofolate. Okay, so this is folate trap. Recently asked question in I9. Yes, we found that in this conversion, you require both folic acid B12. So if B12 and folic acid deficient, this step would not occur. Homocysteine will increase, homocystinuria. So non-classical homocystinuria, B12 deficiency, homocysteine will increase. Folic acid deficiency, homocysteine will increase. We know B12 and folic acid deficiency lead to megaloblastic anemia. Yes, present. We found that methyl malonyl coenzyme is converted to succinyl coenzyme with the help of B12. If B12 is deficient, this step would not occur. Methyl malonyl coenzyme will increase. So if methyl malonyl coenzyme is increased, that is B12 deficiency. In folic acid deficiency, it is normal. Clear? So this question, now we solve questions. Yes. A woman present with fatigue, pallor, glossitis. Pallor matlab anemia. Evaluation revealed macrocytic anemia. Study revealed elevated homocysteine level. Methyl malonyl coenzyme normal. Answer please. Methyl malonyl coenzyme normal. Answer बताओ फटाफट. Yes, the answer would be folate deficiency. Very good. Folate deficiency. यदि यहां पे मैं कर दूं मिथाइल malonyl coenzyme level increased, तो answer would be B12 deficiency. Okay. Cystinuria, cis 6 hexagonal crystal. Cis S6, 6 side के, yes, crystal, hexagonal crystals. Yes, hexagonal crystal. Two cysteine join to form cysteine. Cysteine is dimer. So in cystinuria, तो इसको थोड़ा प्रोनाउंसिएशन भी हम चेंज करते हैं, cystinuria. So in cystinuria, cysteine is excreted, not cysteine. Two cysteine join to form cystine. Yes. कोला है ना, खेलते भी है लाइसिन and arginine excreted in urine. So this is about cystinuria. Okay, तो याद रहेगा, प्रोनाउंसिएशन सिस्टीन और सिस्टाइन एक ही होती है, बट टू डिफरेंशिएट वी प्रोनाउंस इट cystinuria. ओके, तो इट इज a dimer and dimer is excreted. Okay. Now, basic amino acid, mnemonic is his basics are loose. उसके हैं तुम्हारे नहीं हैं. His for histidine. Basic means basic amino acid. R for arginine. Loose for lysine. Loose for lysine. So he is एक positive charge. There are so many positive charge. Name itself tells you most basic arginine. Most basic. Maximum positive charge. Maximum positive charge. Most basic. Mnemonic. Least basic, histidine. So we can remember like this: 3 positive charge, maximum positive charge, most basic. Least positive charge, least basic. So he is, इंग्लिश में ग्रामर पढ़ी है हमने, इज आर एम. एक बंदा होता है तो इस कहते हैं. ही इज एक ही तो है. देयर आर सो मेनी पॉजिटिव चार्ज ऑन arginine. There are, yes, so many positive charge on arginine. They are, he is. Histidine, if you see the ring, side chain of histidine, that is imidazole ring. That is imidazole ring. How you remember histidine is having imidazole ring? Histidine. Dine मतलब खाना खाना. Yes, मिड डे मील भी खा सकते हो तुम, मिडाजोल. मिड डे मील भी खा सकते हो. और इन मिड डे मील यू मे डू बफे. बफे भी कर सकते हो. सो प्रोवाइड मैक्सिमम बफरिंग कैपेसिटी इन ब्लड एट फिजियोलॉजिकल पीएच. सो याद रहेगा. क्लियर. ये अभी नीट हमारे एफएमजी में क्वेश्चन आया है. नाउ एसिडिक अमीनो एसिड, यस, aspartate, glutamic acid, they have negative charge. Basic amino acid positive charge, acidic amino acid negative charge. Now this flow chart is very very important. Every point is question. गोल्ड स्टैंडर्ड फॉर स्क्रीनिंग ऑफ इनबोर्न एरर ऑफ मेटाबॉलिज्म. इनबोर्न एरर ऑफ मेटाबॉलिज्म तुम पढ़ोगे अभी पीड्स में भी सर क्वेश्चन रखेंगे जरूर, मुझे लगता है ऐसा फीलिंग आ रही है. टेंडम मास स्पेक्ट्रोमेट्री. टेंडम मास स्पेक्ट्रोमेट्री. ओके. नाउ we found that phenylalanine is converted to tyrosine by phenylalanine hydroxylase. Phenylalanine hydroxylase. We found that if this enzyme is deficient, this is classical phenylketonuria. In this reaction, tetrahydrobiopterin is converted to dihydrobiopterin. This dihydrobiopterin is converted back to tetrahydrobiopterin by dihydrobiopterin reductase. Biopterin. क्या है ये? Biopterin. Okay. If this enzyme is deficient, then it is a rare variant of phenylketonuria. So they ask question in NEET 25 that phenylalanine hydroxylase enzyme assay was normal. Phenylalanine level increased, tyrosine level low. If this reaction is not occurring, phenylalanine increased, tyrosine will not be synthesized, will be low. Okay. Which of the following cofactor deficiency is most likely responsible? Means phenylalanine hydroxylase is normal, so biopterin would be affected. कौन सा affected होगा? Biopterin. Answer is A. Clear? So I have tried to cover recently asked question of INI and NEET also, so that if question is repeated, yes, most probably will not leave that. Yes. Okay, we found that in phenylketonuria, there is mental retardation, white skin, white hair, mousy odor, musty odor. This is catching point. Musty odor. In tyrosine, now tyrosine is converted to melanin by enzyme tyrosinase. Tyrosinase is classified as oxidase and cofactor is copper. Cofactor is copper. So we found that if tyrosinase is deficient, that is albinism. When tyrosinase is deficient, tyrosine will not be converted to melanin. टायर क्या होता है? इफ यू बर्न टायर, यस, गाड़ी का टायर लो, बर्न करोगे तो काला पिगमेंट मिलेगा ना, ब्लैक पिगमेंट मिलेनिन. सो टायरोसिन इज कमिंग टू मिलेनिन. And if myelin is not synthesized, that is albinism. White hair, white skin, blue sclera, photophobia. Yes, this is blue sclera, blue eyes hypnotize तेरी कर दी है मैनू. ये वो वाली blue eyes नहीं है. तुम मेडिको, तुम्हें पता है वो वाली blue eyes जो hypnotize करती है उसमें iris होता है blue, ना कि sclera. Okay, so photophobia would be there. Okay, you know. We found that tyrosine is precursor for thyroid hormone. Tyrosine is precursor for dopamine, norepinephrine, epinephrine. A question has been asked in our FMG that norepinephrine, epinephrine, the methyl group donor is SAM. The bad boy, ganda bacha. S adenosylmethionine is methyl group donor in this reaction. Our FMG question. Okay. Tyrosine is metabolized in this downward, like this. Okay. In this first enzyme is tyrosine transaminase, 2T, TT, 2 times T, tyrosinemia type 2. T for torch, T for touch. Torch, oculo, touch, cutaneous. Oculocutaneous tyrosinemia. Yes, so question was asked in our FMG. They gave the symptom of eye, yes, keratitis, and cutaneous symptoms were there. And they asked which type of tyrosinemia is this. So type 2 tyrosinemia, touch, torch. Yes, touch and torch. Now, para-hydroxyphenyl pyruvate, hydroxylase or dioxygenase is deficient. 3 times P. So tyrosinemia type 3. Tyrosinemia type 3, 3 times P. Alkaptonuria, नाम अपने आप बता रहा है. ALKA, काला. So wherever you find the kala, black pigmentation, yes, urine turns black on standing. Yes, urine खड़ा नहीं होगा, मतलब if we keep the urine for short time, you will find that it turns black. Okay, so black pigmentation. Oh, naughty boys. Huh? Yes, black pigmentation. Yes, it is called ochronosis, black pinna, black tip. Okay. Yes, this is called ochronosis, and we found that alkaptonuria, homogentisate oxidase is deficient or homogentisate dioxygenase is deficient. Yes, we found question was asked in NEET, not in our FMG, but NEET में आ चुका है बच्चों. उन्होंने क्या दिया? They tried to confuse this name with this. Quite similar name, but you will not be confused in exam. How you will remember homo, two similar thing. Homo, two similar thing. Yes, dihydro, di मतलब दो. Acetate, 2 कार्बन. डाइऑक्सीनेज, दो की बात हो रही है. पैरा हाइड्रोक्सीफिनाइल पाइरुवेट, पी पाइरुवेट, 3 कार्बन, टाइप 3. तो याद आ जाएगा तुम्हें. पाइरुवेट, पैरा हाइड्रोक्सीफिनाइल पाइरुवेट, 3 कार्बन होते हैं पाइरुवेट में, सो टायरोसिनेमा टाइप 3. डाइहाइड्रोक्सीफिनाइल एसीटेट डाइऑक्सीनेज. यस, ओके. टाइप 3 को नियोटल टायरोसिनेमा भी कहते हैं. टाइप 1 फ्यूमेरिल एसिटोएस्टेट हाइड्रोलेज, F4 first, type first. It is also called hepatorenal tyrosinemia. So many times you will, when clinical scenario, they will give you the symptoms of kidney, symptoms of liver, and tyrosinemia. They will ask which type, तो type 1. Okay, ओवरलोडेड हो गया. आई नो स्पीड थोड़ी सी फास्ट है, बट हमने ये पहले कर चुके हैं. नो नीड टू वरी, हो जाएगा. थोड़ा सा इसमें मजे ले लेते हैं. यस, लाइफ में एंजॉय करना चाहिए. यस, Tryptophan is having indole ring. This is question of our FMG. Indole is baby doll. मैं सोने की. So many fans are there. You know, you are also fan, and all fans are trapped. तुम भी trapped हो. Yes. So indole, baby doll. So many fans. All fans are trapped. Yes. Tryptophan is going to serotonin. Serotonin is going to melatonin. Serotonin is going to melatonin. We found that this indole ring, due to this indole ring, it absorbs light maximum at 260 to 280 nanometer. So they will ask which amino acid absorb maximum light. Suppose baby doll goes to any function. Who will be in limelight? Baby doll will be in limelight. Yeah. तुम भी वहीं पे देखोगे। यस, लाइट तुम्हारे हाथ में दबा दे दी जाए तो तुम भी लाइट कहाँ डालोगे? यस, बेबी डॉल। तो we found that 60 milligram of tryptophan, 60 milligram of tryptophan give rise to 1 milligram of niacin. 1 milligram of niacin. Okay, so niacin as Nia Sharma. Niacin as Nia Sharma. 60 milligram of tryptophan give rise to 1 milligram of niacin by this multiple path steps. But we do remember only few steps. 3-hydroxyquinoline. If you don't remember this name, it's okay. Okay. We found that in this conversion, one step is there in which vitamin B6 is required. If B6 is deficient, this 3-hydroxyquinoline is diverted towards janthuric acid, urea. So this question was asked, yes, this question was asked in INI 22. They asked that B6 deficiency lead to janthuric acid urea. This INI they ask in B6 deficiency, quinoline pathway is diverted towards janthuric acid. In this question was in which vitamin deficiency quinoline pathway is diverted towards janthuric acid. So concept same tha? Yes. So B6 deficiency lead to synthesis of janthuric acid. If niacin deficiency is there, B3 deficiency is there, that lead to pellagra, niacin pellagra, diarrhea, dementia, dermatitis. Diarrhea, yes. Yes, diarrhea, dementia, dermatitis. So we found that in pellagra, 3D are there, and the fourth D is death. We found that in niacin deficiency, pellagra is there, and if a patient comes to you having pellagra-like symptom, typical castle-neck appearance, and you found that increase HIA level, that is carcinoid syndrome. Increase HI level, carcinoid. If you remember the C car scene of PK, yes, हया भी नहीं आई, शर्म भी नहीं आई, कैसे कैसे सीन बनाते हैं, कैसे कैसे सर पढ़ाते हैं, कितने नॉन वेज पढ़ाते हैं सर। बच्चों कोई बात नहीं, ऐसी बात नहीं है, अपना याद रखो। यस, डांसिंग कार याद रखो। नो नीड टू वरी सर, कैसी कैसी बातें करते हैं गंदी गंदी। कोई बात नहीं, गंदी बातें याद रह जाती हैं। ओके। ओके, हमें तो याद रखना है हार्टनप डिजीज। Hartnup disease, we found that this is autosomal recessive disorder, AR, A for autosomal, R for recessive disorder. Okay. In this tryptophan and neutral amino acid, name itself tells you T for tryptophan and U for neutral amino acid. Absorption is defective in intestine and renal tubule. So tryptophan is excreted in urine. Amino acid urea in our FMG, this question was asked. If amino acid urea is there, same symptom, the answer would be Hartnup disease. If same symptom, janthonic acid urea, answer would be B6 deficiency. Now, after listening so much of things, you started saying मजा आ गया, और ये मजा मैं हिंदुस्तान के हर युवा को देना चाहता हूँ. So maize as staple diet, if you take maize as staple diet, maize में tryptophan कम होता है, तो क्या होगा? Yes, niacin deficiency हो जाएगी. Okay. Transamination reaction, vitamin B6 is cofactor. This question has been asked in INI recently. Okay. This is transamination. I will not discuss this transamination. Amino acid don't show transamination reaction. Yes, that is polythene, proline, lysine, and threonine. Proline, lysine, and threonine don't show transamination reaction. Main transporter of ammonia is glutamine. Glutamine. Main transporter of ammonia in muscle is alanine. Alanine. Both are question. Now, urea cycle, very favorite topic of our examiner. Okay. In urea cycle, you will remember that CO2 bind with ammonia to form carbamoyl phosphate. First step, if this carbamoyl phosphate synthetase 1 is deficient, this enzyme is deficient, that is hyperammonemia type 1. In this, ammonia will increase. Ammonia will increase. We found that carbamoyl phosphate bind with ornithine to form citrulline by ornithine transcarbamylase. If this enzyme is deficient, then hyperammonemia type 2. Point it out. If this enzyme is deficient, this carbamoyl phosphate will come out of the mitochondria, will take part in pyrimidine synthesis. In pyrimidine synthesis, this carbamoyl phosphate will be converted to orotic acid. Orotic acid will be excreted in urine, orotic aciduria. So in type 2 hyperammonemia, orotic aciduria would be there. Orotic acid urea. Okay. In type 1, orotic acid would not increase. So you can easily remember carbamoyl phosphate synthetase 1 deficiency, this enzyme deficiency, hyperammonemia type 1, ammonia is increased. Ammonia is increased. In ornithine transcarbamylase deficiency, hyperammonemia type 2, ammonia increases. Ammonia will increase definitely. Orotic aciduria would be there. Citrulline will not be synthesized, so citrulline decreases. Citrulline decreases. Clear? Now, question देखते हैं बच्चे. दो क्वेश्चन आए हैं रिसेंटली. The neonate present with seizure, low citrulline level, hyperammonemia, normal orotic acid. So if defect at this level or this level, orotic acid level, yes, the citrulline will not be synthesized. So if CPS1, if in this also citrulline will be low. So citrulline is low, orotic acid normal. So this is type 1 hyperammonemia. In this question, if I say orotic acid level is increased, the answer would be, please do comment. Answer would change to, yes, hyperammonemia type 2, as they asked question previously. 2-month-old infant, poor feeding, vomiting, lethargy. Laboratory studies show hyperammonemia, elevated level of orotic acid in urine, which was the most likely enzyme deficiency. The enzyme was ornithine transcarbamylase. Answer is B. Clear? Are you getting this? Now, one more option they have asked multiple times: ornithine transporter deficiency lead to triple H syndrome. Ornithine transporter. Oh, yes, that is hyperammonemia, homocitrullinemia, hyperornithinemia. Again, yes, hyperammonemia, क्योंकि यदि ये ornithine वापस नहीं जाएगा, it will not go back, ammonia will not be detoxified, hyperammonemia. Yes, ornithine will increase, hyperornithinemia. Yes, homocitrullinemia. So this word triple S syndrome has been asked in option multiple time, not answer according to recall, but in option. So that's why we will remember it. In urea cycle defect, what is the treatment? Either you give benjoic acid. Treatment, we will give benjoic acid, will bind with glycine to form hippurate. जो हिप्पी लोग होते हैं है, वो बेंजो बजाते हैं, है ना, गलियों में बेंजो बजाते हैं. क्वेश्चन आया हुआ है. यस, सो यू विल रिमेंबर लाइक दिस. वी फाउंड दैट अनदर ट्रीटमेंट इज फिनाइल ब्यूटारेट. अब मैं कुछ और बोलूंगा बजाने के बारे में तो बच्चे कहेंगे सर नोटी है ना. यस, फिनाइल ब्यूटारेट, फिनाइल एसीटेट, ग्लूटामीन. Okay, we found that phenyl butyrate is converted to phenyl acetate. It binds with glutamine. It is converted to phenyl acetyl glutamine, which is excreted in urine. Yes, कोई नहीं, यूट्यूब पे चलने दो, कोई फर्क नहीं पड़ता. अपने को याद करना है भाई, है ना, पेपर क्लियर करना है, रोकेगा नहीं कोई अपने को. यस, इस बार 200 पार. Yes, with firm determination, with positive attitude, with positive thinking, with all method. 250 नोटी. चल 250 पार भी कर जाएंगे, है ना. यस, ये मुट्ठी में ही हमारी पावर है. चलो निमोनिक बनाएंगे अभी. सो अभी लास्ट तक कौन पढ़ेगा? यस, जो भी पढ़ेगा वो कहेगा यस, टिल लास्ट आई विल रिमेन with books, with positive attitude. Yes. And your yes will confirm your willpower to clear this exam. Okay, dear. Yes, we come back to our topic. We found that in urea cycle, this fumarate is produced, and this fumarate directly enter Krebs cycle. So connecting link between urea cycle and Krebs cycle is fumarate. Question. We found that aspartate and oxaloacetate. We found that oxaloacetate bind with ammonia to form aspartate. So they ask connecting amino acid between urea cycle and Krebs cycle. If they ask connecting link, then fumarate, best answer. But they change the question, connecting amino acid, then answer would become aspartate. Answer would become aspartate. Now, 21st amino acid. Yes, selenocysteine, produced by co-translational modification. Normally, there are three stop codons, UGA, UAG, sorry, UAA, UAG, UAG, UGA, UAA. Three stop codons are there. We found that whenever these three stop codon comes, protein synthesis stops. But we found that in few protein synthesis, these are enzymes, proteins. In these protein synthesis, stop codon UGA, code for selenocysteine. UGA yoga से ही होगा. Selena Gomez is so fit by yoga. Yoga से ही होगा. And she is so fit. That's why you praise her. You praise her for her thigh reason, gluteal reason, gully, dehydrogenase. है ना? Yes. So selenoprotein P, glutathione peroxidase, glycine reductase. Yes. Thyrodoxine reductase, dehydrogenase. Question has been asked. So याद रहेगा. Stop codon in mitochondria. Mitochondria stop codon. Stop codon. Those are AGG, AGARWAL, Agarwal. Agarwal. Yes, these are stop codon. My wife is Agarwal and she always stop. Okay. अब तो YouTube पे भी है. देखो जब फंस जाएंगे देखी जाएगी, डरदा नहीं है ना? Yes, she always stops me. We found that both Agarwal. So previously the spelling of Agarwal was like this. So astrologer के पास गया मैं. He said कि डॉक्टर साहब डोंट वरी, ठीक हो जाएगा सब. चेंज. माय वाइफ नहीं, स्पेलिंग ऑफ अग्रवाल. ओके. उसने कहा चेंज में सोचा वाइफ नहीं, वाइफ ने चेंज करनी बट अग्रवाल की चेंज, स्पेलिंग चेंज. आई चेंज्ड एजीए. Even now she stops me. So both Agrawal, it may be AGG or AGA, these are stop codon in mitochondria. My मतलब मेरा, ये अपनी बात कर रहा हूं मैं. ओके. यस. ठीक है. तो ये बताना नहीं है किसी को, कॉन्फिडेंशियल है. हालांकि यूट्यूब पे है बट कॉन्फिडेंशियल है. ठीक है. यस. बफर रेसिस्ट चेंज इन pH on adding acid and alkali. Acid and alkali, if you add this, buffer resists the change. Buffer is most effective at pH equal to pKa. Means you are adding alkali. Look at the screen. You are adding alkali. So pH is increasing. Okay. As you add alkali, pH increases. But at this point, no change in pH. No change in pH. So you can say buffer is most effective at pH equal to pK. So you can say this is pK. So titration curve of weak acid with one ionizable group, maximum buffering capacity at point B. So this is pK. Now, yes, we found that P in this graph, you can see that here what happened? You added alkali, pH increases. But at this point, no change in pH. That is maximum buffering capacity, pK1. फिर pH increases by adding alkali. At this point, no pH change. That is again maximum buffering capacity, pK2, pK1, pK2. So titration curve of two ionizable group, titration curve of one ionizable group, you can identify. And we found PI, isoelectric point, is the average of pK1 and pK2. If they ask question that pK1 is 2.9 and pK2 is 9.1. So what is PI? So 2.9 plus 9.1 divided by 2, 12 divided by 2, 6. The answer was 6. So isoelectric point is the pH at which net charge on deuter ion is 0. Okay. What is deuter ion? Means having two equal and opposite charge. Okay. So till now, they have asked question on this. If they give you graph, you can identify this is one ionizable group. Here there are two ionizable group. If I extend it, and now I ask you how many ionizable group? Please do comment. How many ionizable group? Yes, 3 ionizable group. Okay. Now we come to genetics, molecular biology. Yes, we have 45 minutes around. In 45 minutes, we are left with, yes, 30 pages. So we will cover. We found that purine base, adenine and guanine, pyrimidine base, cytosine, uracil, and thymine. We found that purine are made up of aspartate, glutamine, CO2, glycine, and folic acid, tetrahydrofolate. Aspartate, glutamine, and CO2 pyrimidine ring. This is purine ring. This is pyrimidine ring. Initial three compounds are same. Initial three compounds are same. So this is glutamine, not glutamate. It is glutamine, not glutamate. 6:45 तक क्लास खत्म करूंगा. Okay. Yes. Yes. So this question was asked, which of the following does not contribute purine ring? That was, yes, glutamate. Glutamine contribute करता है, aspartate contribute करता है, glycine contribute करता है. Yes, but not glutamate. Answer is yes. Okay. We found that dideoxyribose or dideoxynucleotide, we found that dideoxynucleotide don't have OH at C3 and C2. So if we add in PCR, DNA synthesis or PCR will stop. So if you add dideoxynucleotide, DNA synthesis stops. Dideoxynucleotide, question. Dideoxynucleotide used in DNA sequencing. If I give you a nucleotide sequence and I ask you what is the nucleotide sequence, you will say I can do by chain termination method or Sanger sequencing. Chain termination method or Sanger sequencing, you can tell me the nucleotide sequence in DNA. DNA का sequence बता सकते हो. In this, what you use? Dideoxynucleotide. But if this dideoxynucleotide you use in PCR or DNA synthesis, PCR or DNA synthesis will stop. Clear? These are direct questions. DNA is usually double-stranded. RNA is usually single-stranded. A, T, 2 hydrogen bond. G, C, 3 hydrogen bond. Base pairing rule. A, T, 2 hydrogen bond. G, C, 3 hydrogen bond. A, U, G, in place of T, there is U. RNA में U होता है, DNA में T होता है, usually. In DNA, sugar is deoxyribose. RNA, sugar is ribose. Question. This question was asked, identify the bond AT. These two bonds, AT, two hydrogen bond. These are two hydrogen bond. These are two hydrogen bond. 3 hydrogen bond. So these are hydrogen bond. Okay, hydrogen bond. Okay. Now, in purine catabolism, first question, purine catabolism end product is uric acid. First question. In purine catabolism, rate limiting enzyme xanthine oxidase. Second question. This is rate limiting enzyme. Third question, allopurinol inhibit this xanthine oxidase. Third question. Fourth question, that in purine catabolism, adenosine is converted to inosine by adenosine deaminase. अड्डा, यस, जो गुंडों का अड्डा होता है ना, वहां पे सीआईडी छापा मारती है, एससीआईडी. इफ एडिनोसिन डीएमिनेज इज डिफिशिएंट, दैट लीड टू सीवियर कंबाइंड इम्यूनोडिफिशियंसी. सो सिंपल निमोनिक, अड्डे पे सीआईडी ने छापा मारा. यस, ओके, सीआईडी अड्डा. ओके, we found that salvage pathway, or there is enzyme HGPRT. If this HGPRT complete deficiency, Lesch-Nyhan syndrome, this is X-link. Eyelashes are related to X. Okay, अपने X के eyelashes याद मत करना. Okay, self mutilation कोई फायदा नहीं याद करके, दुख होगा. Gout, in this self mutilation would be there. दुख होगा, self mutilation. Yes. Gout. So they will give you image-based question. So many times they have asked. Recently in January 26, they asked the same thing. Self-mutilation, finger biting. Yes. Hyperuricemia. Yes. HGPRT deficiency. HGPRT deficiency. Okay. DNA replication. As I told you that रेयरली आस्क, बट यू कांट एक्सपेक्ट कि कुछ भी आ सकता है. INI 26 में आ गया उन्होंने. हालांकि सिंपल क्वेश्चन था, विच ऑफ द फॉलोइंग एंजाइम इज रेस्पॉन्सिबल फॉर सिंथेसिस ऑफ आरएनए प्राइमर ड्यूरिंग डीएनए रेप्लिकेशन. द आंसर वाज यस, प्राइमर इज सिंथेसाइज्ड बाय यस प्राइमेस. प्राइमेस. ओके, टोपोआइसोमरेज रिमूव सुपर कोयलिंग. टोपोआइसोमरेज रिमूव सुपर कोयलिंग. सुपर कोयलिंग. यस, सेरिबेलम में मिलेंगे और फिर डिटेल में डिस्कस करेंगे बहुत सारी चीजें. यस, डीएनए पॉलीमरेज 2 and 3, डीएनए पॉलीमरेज 3 सिंथेसाइज कंप्लीट लीडिंग स्ट्रैंड एंड आल्सो ओकाजाकी फ्रेगमेंट्स. ओकाजाकी, ये पहले क्वेश्चन आ चुका है हमारे एफएमजी में. ओकाजाकी फ्रेगमेंट्स आर सिंथेसाइज्ड बाय डीएनए पॉलीमरेज 3. ओके, डीएनए पॉलीमरेज 2 मेनली रेस्पॉन्स डीएनए रिपेयर. DNA repair. Okay, so these are the questions. Now, clean out fragment. Yes, clean out fragments. Clean out fragment क्या करता है? Yes, we found that DNA polymerase 1 है. Look at the screen. We found that DNA polymerase 1, 2 and 3 all have polymerase activity, all have the same activity. Synthesis always occur in 5 to 3 direction. Proofreading means 3 to 5 exonuclease activity. How you remember? Reading, when we do read, we read 1 2 3 4 5, 3 to 5 exonuclease. Primer removal is done by 5 to 3 exonuclease. Direct question they have asked. Primer removal is done by 5 to 3 exonuclease activity. Okay, so we found that in DNA polymerase 1, question has been asked, extra feature in DNA polymerase 1 is this primer removal activity. So if I take DNA polymerase 1 and I remove this part, now DNA polymerase 1 is called clean out fragment. So clean out fragment is nothing but DNA polymerase 1 without, yes, primer removal activity. Primer removal activity. Yes, primer removal activity. Clear? Yes. Now, these are repair mechanism defective. Yes, नॉन होमोलोगस, जिनका घर नहीं है, जो सीआईडी होता है, रो एजेंट होते हैं, दे डोंट हैव एनी होम. सो निमोनिक, नॉन होमोलोगस and joining, this is DNA repair mechanism. If this repair mechanism is defective, that can lead to disorder, severe combined immunodeficiency, SCID. So mnemonic CID, रो एजेंट. yes, सल्लू भाई टाइगर मूवी देखी तुमने, was not having home. Yes, he was enjoying because he was having Katrina. Yes. Now Dhurandhar movie. Yes, he was not also having home initially. Yes, बाद में तो था. Anyways, so no home. लेकिन we people at home हम क्या करते हैं घर पे? मैं क्या करता हूँ स्पेशली, तुम्हारे बारे में बात नहीं कर रहा मैं. What I do at home? आटा, तेल. Ataxia telangiectasia like disorder. Ataxia telangiectasia like disorder. Okay. निज मैगन ब्रेक सिंड्रोम, मैगी. यस. निज मतलब इन हिंदी में अपनी होती है, अपनी मैगी खुद बनानी होती है. बनाते हुए तुम्हें पता होगा कैसे करते हैं, तोड़ते हैं ब्रेक करके. यस. निज मैगन. ब्लूम एज ब्रूम, झाड़ू भी अपने आप लगाता हूं मैं. वर्नर एज बर्नर, बर्नर पे चाय भी बनानी पड़ती है. रोथ मुंड थॉमसन, हे थॉमसन, यदि मूड नहीं है वाइफ का तो रोटी भी खुद ही बनानी पड़ेगी. रोटी भी खुद ही बनानी पड़ेगी. सो यदि मूड नहीं है तो रोटी भी बनाता हूं मैं. यस. थॉमसन सिंड्रोम. ब्रेस्ट कैंसर ससेप्टिबिलिटी, ये सब घर की ही चीजें अच्छी हैं, बाहर नहीं जाना बच्चों, है ना. यस. न्यूक्लियोटाइड ऑक्सीजन रिपेयर डिफेक्ट, निमोनिक इज ट्राई जीरो कैलोरी कोक. अब स्पेलिंग इसकी कुछ भी लिख लो तुम. यस. सो कुकायन सिंड्रोम, ट्राइकोथायोडिस्ट्रोफी, जीरोडर्मा पिगमेंटोसा. यस. ट्राई मतलब तीन. यस. न्यूक्लियोटाइड में तीन चीजें होते हैं, टाई, ट्राई. ओके. यस. दिस क्वेश्चन हैज बीन आस्क्ड. A child present with multiple freckles, severe photosensitivity, early onset skin cancer. What is the primary underlying molecular defect? This clinical presentation is xeroderma pigmentosa. Yes. Normally, ultraviolet rays produce thymine dimer corrected by nucleotide excision repair. If nucleotide excision repair is defective, that lead to xeroderma pigmentosa. In this, skin rash, blister on sun exposed area susceptible to skin cancer would be there. Okay. We found that, yes, इसको हम हटा देते हैं for the time being. Yes. So this is nucleotide excision repair defect. Nucleotide repair defect answer is A. Clear? Now, base excision repair, MUTYH एसोसिएटेड पोलिपोसिस, तुम्हारी मिट्टी में ही तुम्हारी बेसिक पावर है ना. नन्हे मुन्ने बच्चे, तेरी मुट्ठी में क्या है? मुट्ठी में है तकदीर हमारी. तो हमारी तकदीर है, तो बेसिक पावर भी वहीं पे है. मिसमैच रिपेयर, हेरिडिटरी नॉन पॉलीपोसिस, कोलोरेक्टल कैंसर, लिंच सिंड्रोम. यस. मिसमैच. मिस तुम्हारा लंच ना बनाएगी, कुछ भी निमोनिक बना लेना, बट डेफिनेटली विल रिमेंबर, आई नो. दिस रिसेंटली आस्क्ड न्यू टॉपिक, oncogene addiction. Means in cancer cell we found that multiple mutation may be there, but cancer cell use predominantly only one pathway for survival, depend predominantly on a single oncogenic pathway for survival, and this is good for us. We target that pathway and we can treat the patient, allowing targeted therapy against that pathway. So this is oncogene addiction. Okay. So this is about nucleotide excision repair defect. Transcription. DNA to RNA is called transcription. This is double-stranded DNA. This is coding strand. This is template strand. Coding, template. We found that in coding and template, two strands are separated. Now this template strand will take part in RNA synthesis. This bulb is RNA polymerase. This RNA polymerase will synthesize RNA. Yes, कोडिंग के पास इंफॉर्मेशन है, कोड है, इंफॉर्मेशन है, नॉलेज है. जिसके पास नॉलेज होती है वो काम नहीं करता. यस. ही हैज सो मेनी सर्वेंट्स. ओके. और पीजीज, जो कंसल्टेंट है वो काम नहीं करता, पीजी काम करते हैं. इन द सेम वे दिस इज टेम्पलेट, दिस इज कोडिंग. टेम्पलेट स्टैंड विल डू सिंथेसिस. बेस पेयरिंग रूल विल बी फॉलोड. आरएनए पॉलीमरेज सिंथेसाइज आरएनए. टी बेस पेयर विद ए बेस पेयर विद यू. आरएनए में टी नहीं होता. सी बेस पेयर विद जी, यू, सी, सी, ए. So this is messenger RNA. Okay. So we found that this is 5 and this is 3 and this is 3 and this is 5 and two strands are always anti-parallel. Two strands are always anti-parallel, 5 and 3 and 3 and 5 and two strands are anti-parallel. So we found this is 5 and this is 3 and if you compare, this is coding strand, this is messenger RNA. So you can see coding strand and messenger RNA, first is A, T is replaced by U. G, G, T replaced by U, C, C, A, A. So messenger RNA is just like coding strand, except T is replaced by U. So in this question, they have given, yes, coding strand DNA sequence is this. They have given coding strand. So messenger RNA would be just like coding strand, except T will be replaced by U. So GUG. So if coding strand is given the question, you will not do any work. Just write the same sequence, except T is replaced by U. Okay, got the point? Post-transcriptional modification means after this RNA synthesis, this RNA is modified. What are these modification? We found that in DNA, these are exon. Exon take part in protein synthesis. Introns don't take part in protein synthesis. Don't take part in protein synthesis. Don't take part in protein synthesis. So a question was asked, if mutation occur at this intron, what will the effect on protein? Protein would be normal because introns don't take part in protein synthesis. Now when DNA synthesize RNA, this is transcription. This exon, this is exon, this is exon, this is intron, this is intron. Intron don't take part in protein synthesis, so these are removed. This removal of intron is called splicing. Removal of intron and joining of exon. These introns are removed and exons are joined. This is called splicing, and this is done by small nuclear RNA. RNA is having enzymatic activity. RNA having enzymatic activity is called ribozyme. So snRNA is ribozyme. Another modification, one modification, you remove this intron. Second modification, you attach cap at 5 end. You attach cap at 5 end. You attach cap at 5 end. You attach poly A tail, 40 to 20 times, 40 to 20, 200 times, sorry, 40 to 200 times poly A tail. This is, yes, modification. At 5 end, you attach cap. At 3 end, poly A tail. Splicing. Other than that, you do methylation. The question has been asked, which is not part of post-transcriptional modification. Okay, one option was glycosylation, not glycosylation. Yes, capping, poly A tail, splicing, methylation is part of post-transcriptional modification. Post-transcriptional modification. Fifth modification is RNA editing. Has been asked multiple times. RNA editing. We know that liver synthesize VLDL contain ApoB100. Intestine synthesize chylomicron contain ApoB48. ApoB100 and ApoB48 are protein. We found that there is one gene, ApoB100 gene. This gene synthesizes this messenger RNA. When we saw this messenger RNA, in this messenger RNA, there was CAA and UAA. UAA is stop codon. CAA code for any amino acid, I don't care. Okay. In liver, this RNA in liver take part in protein synthesis. Protein synthesis stops because UAA is a stop codon. UAA is stop codon. But in intestine, same messenger RNA is modified. Same messenger RNA, this cytosine is converted to uracil by cytosine deaminase. Cytosine deaminase converts cytosine to uracil. UAA is stop codon. So means new stop codon introduced at this point. So when this same messenger RNA in intestine take part in protein synthesis stops here. So smaller protein is produced. And this phenomena is called RNA editing. Editing. RNA editing. You edited the RNA. Cytosine is going to Russell, new stop codon, protein synthesis stops in the middle, and we found that this new protein was having 48% molecular weight of ApoB100. Means molecular weight of ApoB48 is 48% of ApoB100. That's why it was called ApoB48. And this happened due to which concept? RNA editing. So ApoB48 synthesized by RNA editing. Got the point? Now, hope you are getting the points. Now we come to epigenetics. Look at the screen. We found that this is nucleus. In this nucleus, if you stain the nucleus, you may find relaxed, means lightly stained, darkly stained. So in nucleus, the chromatin may be darkly stained, that is heterochromatin, lightly stained, euchromatin, darkly stained, heterochromatin, that is condensed hai, tight hai. Look at me. Suppose this pen is histone protein. Histone protein is having positive charge. This is double-stranded DNA. Yes, that is negative charge, having negative charge. Due to opposite charge, they are tightly attached. DNA is having negative charge. Histone is having positive charge. Due to opposite charge, they are tightly attached. When they are tightly attached, they will not make RNA. You know, if you want to synthesize RNA, these two strands of DNA are separated. So you can't separate DNA, so you can't synthesize RNA. यार देखो यार, बॉयफ्रेंड गर्लफ्रेंड है, एक के पास पॉजिटिव चार्ज है, एक के पास नेगेटिव चार्ज, टाइटली हक करके रहते हैं, प्यार से रहते हैं, है ना? यस, कंडेंस्ड कुछ काम नहीं करते, बस निब्बा निब्बी बने हुए हैं, काम नहीं करना है, ट्रांसक्रिप्शनली इनएक्टिव. ओके, यस. नाउ व्हाट हैपेंड? बॉयफ्रेंड स्टार्टेड स्मोकिंग. Suppose you do acetylation of histone. Acetyl, negative charge. Acetylation of histone means negative charge acetate, positive charge of histone. तुम स्मोकिंग करते हो, इरेक्टाइल डिस्फंक्शन हो गया, गर्लफ्रेंड छोड़ के चली गई. Same happened here. Yes, acetylation of histone, positive charge of histone is lost and DNA will leave it. Yes, DNA is relaxed DNA will synthesize RNA, transcriptionally active, relaxed DNA. So acetylation of histone, yes, acetylation of histone activate transcription. ओके, सो निब्बा निब्बी नहीं बनना बच्चों, और स्मोकिंग भी नहीं करना. यस, पढ़ाई करनी है. यस, एक्टिवेट ट्रांसक्रिप्शन. ओके, we found that this is DNA. In DNA, this is promoter region. This is promoter region. In promoter region, if I attach methyl group to cytosine, methylation of cytosine, then decrease transcription. Methylation of DNA, mute. M for methylation, F for mute. Methylation of DNA, mute. Okay. Acetylation of histone activate, methylation mute. Okay. Epigenetic is reversible, heritable chemical modification of DNA, methylation of DNA, or histone, acetylation of histone without changing in nucleotide sequence is called epigenetics. Got the point? Now, जीनोमिक इम्प्रिंटिंग क्या है? ये क्वेश्चन आया हुआ है, पैथो में तुमने पढ़ा हुआ होगा, फास्ट देख लेते हैं. यस, वी फाउंड दैट दिस इज क्रोमोसोम 15. दिस इज मैटरनल जीन और एलील. For a particular gene, 2 alleles are there. For maternal, this maternal is working. Paternal is methylated. Methylation mute. So this is not working. Suppose this maternal is deleted. Suppose this maternal allele is deleted. Paternal is inhibited. This is I for inhibited. I for imprinted. Yes, paternal is imprinted, inhibited. Maternal was working. Suppose you delete. Maternal is deleted. That is Angelman syndrome. तो एंगलमैन सिंड्रोम, अंडर नॉर्मल सिचुएशन क्रोमोसोम 15 पैटर्नल एलील इज इम्प्रिंटेड इनहिबिटेड, ओनली मैटरनल एलील इज वर्किंग। एंजलमैन सिंड्रोम में क्या होगा, मदर कॉपी ऑफ एलील इज डिलीटेड लीडिंग टू वेरियस साइन एंड सिम्टम। ठीक, क्लियर। पेड्राविलाई अपोज दूसरा है। पेड्राविलाई में क्या है, दिस इज, यदि मैं चेंज कर दूं अनदर जी एलील जीन एट क्रोमोसोम 15, दिस इज मैटरनल, दिस इज पैटर्नल, मैटरनल is imprinted, not working. This paternal was working. If I delete this paternal, delete, paternal is deleted. If paternal is deleted, that will lead to Prader-Willi. So under normal situation, chromosome 15 maternal allele is imprinted. Only paternal allele was working. In Prader-Willi syndrome, paternal also related, resulting in both copies of gene not working. Clear? Now, image-based question they ask, in this paternal is deleted. So answer is, answer बताओ फटाफट, Prader-Willi syndrome. Prader-Willi syndrome. Okay. In the same question, if I change, in the same question, if I change, yes, यहां पे हम पी कर, यहां पे हम पी कर देते हैं, यहां पे एम। तो आंसर बताओ, मैटरनल इज डिलीटेड, मैटरनल इज डिलीटेड, यस, ओके, क्लियर। Micro RNA, two questions are usually asked. Micro RNA, this is micro RNA, bind with messenger RNA and inhibit protein synthesis. Micro RNA bind with messenger RNA and inhibit protein synthesis. So first question, micro RNA is very small, micro है 21 to 23, sometimes you will find 25, okay, 21 to 25, 21 to 23, 21 to 24 nucleotide long. It bind to 3 and untranslated region. 3 untranslated region. It bind to 3 untranslated region. Yes. And inhibit protein synthesis. And this phenomena is called gene knockdown. Gene knockdown. So this is microRNA or RNA-induced silencing complex, RNA interference, small interfering RNA, siRNA, silencing RNA, एक ही बात है, थोड़ा सा डिफरेंस है, लेकिन क्वेश्चन पर्पस के लिए, yes, this microRNA is interfering with messenger RNA from protein synthesis. So interfering RNA, small interfering RNA or RNA interference, it is silencing this messenger RNA. तो silencing RNA ऐसे याद रख सकते हैं. So mechanism involved in RNA interference, G knock down. इन एंड आउट से कंफ्यूज हो इसीलिए हमने निमोनिक बनाया माइक्रो आरएनए, इफ यू रोटेट वंस M looks like 3, so 3 untranslated region, it bind to 3 untranslated region. Rotate once more down, yes, W, no, knock down, okay, no, not in out. Now, degeneracy of codon means more than one codon for single amino acid. UCA code for serine, UCU code for again serine. Means one amino acid is having more than one codon, one person is having more than one girlfriend boyfriend. ओके, तो आजकल बड़ा कॉमन है, तो एक बंदे के एक से ज्यादा गर्लफ्रेंड बॉयफ्रेंड है, उसे कहेंगे डीजेनरेसी ऑफ कोडोन. वन अमाइनो एसिड मोर देन वन कोडोन, यूसीए यूसीयू. बट वी फाउंड दैट initial two nucleotide are same. So Vobel hypothesis says third nucleotide of codon is not so specific. Means if you change third nucleotide, just like I changed this A with U and the new codon code for serine. So third nucleotide is not so specific. If I change the third nucleotide, there are chances that the new codon may code for same amino acid. This is, yes, Vobel hypothesis. So Vobel hypothesis and degeneracy of codon are interrelated. Question has been asked. Polymerase chain reaction. In polymerase chain reaction, what we take in the test tube? We take double-stranded DNA, or target DNA, you can say target DNA. We take 2 types of primer, one primer for each strand. Taq polymerase, DNA polymerase, which can tolerate high temperature, Taq polymerase. Deoxynucleotide, we want to synthesize DNA, that's why we take deoxynucleotide. Magnesium and buffer, magnesium and buffer, yes, magnesium as cofactor for polymerase, buffer maintain करते हैं हम. Okay, now what are the steps? Denaturation, annealing, extension, ये question आ चुका है 2-3 बार. Let's see. First of all, we heat the test tube or thermocycler. As we heat, two strands are separated. We decrease the temperature, primer attached. Two strands are separated, that is called denaturation. Two strands separated. Decrease temperature, primer attached, that is called annealing, primer attached. Then DNA polymerase, Taq polymerase synthesize DNA, that is extension, polymerization of DNA. तो sequence पे question आया हुआ है. This was question of our FMG 2 times. Recently in INI they asked the same question. Okay, what is real? So this is sequence. What is PCR? From 1 to 2, 2 to 4, 4 to 8. After each cycle, number of copies double. क्या कहा मैंने? After each cycle, number of copies double. याद रखना, क्वेश्चन सोल्व करोगे. Real time PCR, we use cyber green dye. And this is quantitative PCR. This question was asked FMGA monkeypox detection. Monkeypox virus के डिटेक्शन में technique used is real time PCR. क्यों? Monkeypox virus is double stranded DNA virus, so we use real time PCR. Okay. Restriction endonuclease. Restriction endonuclease cut palindrome. Cut palindrome. What is palindrome? How you will recognize? Yes, palindrome. If sequence is given, suppose they ask what is palindrome. Out of these 4, which is palindrome? How you will identify? Base pairing rule, A, T, G, C. Base pairing rule, A pair with T, G pair with C. A base pair with T. First and last, base pairing rule is not followed. This is not palindrome. A base pair with A, no, A base pair with T. Base pairing rule is not followed. G base pair with C, base pairing rule is followed. G base pair with C, base pairing rule is followed. This is palindrome. TAAT, TT, base pairing rule is not followed. This is not palindrome. Other example of palindrome. Yes, this is not palindrome. This is palindrome. You can see. Yes, TAAT is not palindrome, but TATA is palindrome. कैसे? TA base pairing rule is followed. AT base pairing rule is followed. If base pairing rule is followed, this is palindrome. In the same way, AT base pairing rule is followed. CG base pairing rule is followed. TA base pairing rule is followed. This is also palindrome. This is also palindrome. So you want to identify palindrome, you can easily identify by base pairing rule. Clear? साउथ का डोसा, नॉर्थ की रोटी, वेस्ट का पिज्जा. यस, साउथ, साउदर्न ब्लोटिंग डीएनए, नॉर्दर्न ब्लोटिंग आरएनए, वेस्टर्न ब्लोटिंग फॉर प्रोटीन. यस, साउथ का डोसा, नॉर्थ की रोटी, वेस्ट का पिज्जा. दिस क्वेश्चन as DNA protein interaction can be studied by using DNA footprinting. Answer is B. Let me tell you, this is steroid hormone receptor, is a protein. We found that steroid hormone receptor has finger-like projection. Finger-like projection. Those are called zinc finger motif. In this, zinc is there. This is DNA. So steroid hormone receptor bind with DNA with the help of these finger-like projection. These are called zinc finger motif. So protein bind with DNA by zinc finger motif, one type of motif. Steroid hormone receptor specifically bind with zinc finger motif. Yes. DNA protein interaction can be studied by using DNA footprinting. Mnemonic क्या बनाया हमने? ये बत्तख है. This is just like a duck. It is having foot, तो footprinting. Mnemonic है ये. Mnemonic याद रख लो. Question हो जाएगा तुम्हारा solve. We remember, I do remember, I taught this last year also. This time, this question was asked. Student solved the question just remembering by this zinc. They said, sir, we did not remember anything, but हमें इतना याद था कि उसमें जिंक थी कुछ फिंगर. Yes, तो जिंक फिंगर मोटिफ, स्टेरॉयड हार्मोन रिसेप्टर बाइंड टू स्पेसिफिक डीएनए, steroid hormone receptor bind with DNA with the help of zinc finger motif. With the help of zinc finger motif. Clear? Any doubt? Yes. इसका निमोनिक है बेटा, बत्तख है, डक है, just like duck. Yes, duck is having foot, these two foot, with the help of foot. Yes, so protein DNA interaction by foot printing mnemonic. This is not concept. Yes, yes. Now इनिबिशन फार्मा हो चुका है, कॉम्पिटिटिव नॉन कॉम्पिटिटिव सर ने डिस्कस कर चुका है, बट फटाफट कर लेंगे इसको, ज्यादा टाइम नहीं लगेगा. यस, कैटालिटिक एफिशिएंसी ऑफ एंजाइम इज बेस्ट एक्सप्रेस्ड बाय के कैट अपॉन के एम. कैट अपॉन के एम. यस, कैट माने बिल्ली, के कैट अपॉन के एम, कैटालिटिक कांस्टेंट. कुछ भी निमोनिक बनाया है, कैट ऊपर है. नॉटी बॉयज. यस, ओके. कॉम्पिटिटिव इनिबिशन, नॉन कॉम्पिटिटिव इनिबिशन, अनकॉम्पिटिटिव इनिबिशन. लाइफ में हंसते रहना, मुस्कुराते रहना, नोटी होते रहना. ठीक है, क्योंकि मेडिकोज के लिए नोटी होना बहुत जरूरी है. ओके, चलो. कॉम्पिटिटिव, ओके. Competitive innovation competition occur between two similar person, two MBBS doctors are there, they are competing for this FMG, this NEET, then you will compete with NEET for NEET. But one MBBS, one BMS, no competition. So structure similarity, competitor have structure similarity. They appear in the same exam, bind to active site. They bind to same site. Yes. If they bind to same site, yes, affinity is decreased. Affinity is decreased. This enzyme, suppose this is a mother having two kids. One is inhibitor, one is substrate. If one kid will take care very nicely, अब दो बच्चे हो गए, केयर थोड़ी कम हो जाएगी, प्यार तो कम नहीं होगा. यस, लेकिन केयर कम हो जाएगी. यस, ये काला है तो इसका मतलब इसको प्यार नहीं करेगी क्या? प्यार तो इसको भी करेगी ना. तो yes, some inhibitor will also bind to affinity will decrease, and Km is inversely proportional to affinity. Km is inversely proportional to affinity. काला है तो क्या प्यार नहीं करेगी? प्यार तो उसको भी करेगी. Km increases. V maximum no change, 1 upon V maximum no change. Okay. Non-competition, no change in Km. No structure similarity, you can see. Bind to other side. No change in affinity, no change in Km. Mnemonic is non-competitive. No change in Km. I can pronounce it non-competitive, no change in Km. Okay. Yes. V maximum is decreased. So 1 upon V maximum is increased. Uncompetitive, I write inverted U. Both Km and V maximum are decreased. Both Km and V maximum are decreased. Now, image-based question if asked, you can remember either by concept or by simple mnemonic. Simple mnemonic क्या है? Look at the screen. Competitor cut each other. यदि cut कर रहे हैं, yes. Yes. कट कर रहे हैं तो कंपटीशन. नॉन कंपटीशन, नो कंपटीशन लेफ्ट, यू हैव वोन. यस, साइन ऑफ विक्ट्री वी. साइन ऑफ विक्ट्री, साइन ऑफ विक्ट्री वी. यस, वी. ये भी साइन ऑफ विक्ट्री है वी, बट विद इरेक्टाइल डिस्फंक्शन. वी विद इरेक्टाइल डिस्फंक्शन. यस, अनकॉम्पिटिटिव ये यू है. If you join the ant, you will find U. Uncompetitive. Okay. हो गया. Isoenzyme. Isoenzyme, different form of enzyme which catalyze the same reaction. Different form of enzyme which catalyze the same reaction. Just like glucose is converted to glucose 6-phosphate by hexokinase, glucokinase. Yes, hexokinase, glucokinase. Okay. We found that hexokinase is present in tissue. Glucokinase present in pancreas and liver. Km, low Km, hexokinase low Km, glucokinase high Km, affinity high, hexokinase, glucokinase low affinity. How you will remember? Helicopter. If you want to travel a short distance, you will use helicopter. If you want to drop bomb to another country, हम bomb तो डालते हैं, हम तो प्यार के पुजारी है. If you want to drop love to another country, यदि दूसरे कंट्री में तुम्हें क्या डालने जाना है, तो क्या लेके जाओगे? हाँ, धुरंधर की तरह जेट लेके जाओगे। ओके, तो हाई किलोमीटर, यस यू विल नेवर फॉरगेट हाई किलोमीटर, हाई केएम ग्लूकोकाइनेस, लो केएम hexokinase. Yes, so they catalyze the same reaction, but their properties are different. Their molecular weight are different. Physical property, organ distribution is different, but they catalyze the same reaction. In the same way, LDH1 is present in heart, LDH2 is present in RBC. कैसे याद रखोगे? एक ही तो दिल है, किस किस को दूं, है ना? LDH1, एक ही तो दिल है मेरा, किस किस को दूं, है? हार्ट। आरबीसी, आरबीसी इज बाइलोब्ड, दो लोब होते हैं उसमें, एसईसी होती है आरबीसी, तो LDH2 इज प्रेजेंट इन आरबीसी। यस, yes, LDH2 is too much. Normally, in our blood, if I take a sample of a normal person, we found that LDH2 is more than LDH1 in blood. Mnemonic is LDH2 is too much. If myocardial infarction occur, then muscle cell death would occur. It will release LDH1. So LDH1 will increase in blood. So LDH1 concentration will be more than LDH2. So normally LDH2 is more than LDH1, but in MI, LDH1 is more than LDH2. This is called flipped pattern. If you take a coin, flip head and tail, flipped pattern of, yes, LDH. Recently asked question in our FMG. Now we come to vitamins, and it would take hardly 10-15 minutes to cover all these vitamins. Yes, we have covered few things. Thiamine, vitamin B1. Active form of thiamine is thiamine pyrophosphate. The best part is that all things we have, yes, written on these slides. Okay. Thiamine pyrophosphate, cofactor for transketolase. Transketolase, no energy is produced. Is also cofactor. It is also cofactor. Yes, it's also cofactor for oxidative decarboxylation. Energy produced. Energy produced. Thiamine is present in aileron layer of grains. PSM में पढ़ा होगा. Lost by polishing. So parboiling करते हैं हम. Yes, parboiling, when we do parboiling, yes, aileron layer attach, yes, to the grain, so not lost by polishing. So this polish word is so important that they are asking again and again. If patient is taking polished rice, and in NEET PG 24 they gave एक थाली, उसमें दिया खाना, और they gave rice in that थाली, and they pointed out towards rice कि ये खा रहा है तो क्या होगा? थायमिन डिफिशियंसी होगी है ना? तो पता नहीं क्यों, बट यस, thiamine deficiency, polystyrene relation question is asked. Okay, so now if thiamine is deficient, that lead to dry beriberi, wet beriberi. Characteristic point: high output cardiac failure. Okay, and cardiac failure होगा तो edema वगैरह होगा, pitting edema होगा. Yes, symmetric motor and sensory neuropathy. Common cause of thiamine deficiency, chronic use of diuretic. This is very, very important. This question has been asked in our FMG. Point it out. Polystyrene, chronic alcoholic use. And they use that information in NEET. In NEET, recently, they gave this question a non-alcoholic. जैसे ही students ने देखा non-alcoholic, they excluded thiamine. No, they gave hypertensive patient on hydrochlorothiazide diuretic. Diuretic, chronic use of diuretic also cause thiamine deficiency. Alcohol is not the only cause. So in this, thiamine deficiency may be there. Symptoms: symmetric tingling sensation. Yes, symmetric motor and sensory neuropathy. High output cardiac failure. Yes, cardiac failure, pedal edema, thiamine deficiency. Answer is thiamine deficiency. Clear? So they are asking same question. The reason I am telling you, because in all subjects they are asking same question, same topic, with little bit modification, with the help of chat GPT से कर रहे हैं या अपना दिमाग लगा रहे हैं, we don't know. So हमें पता है कि we have learned everything, we have worked hard, so we can handle these questions if we have confidence, we have presence of mind. Okay, हम वहां पे पॉजिटिव रहेंगे, yes, confident रहेंगे, we will trust on our hard work, we have covered each and every topic, with very clear concepts, तो हमें पॉजिटिव रहना है, एंड आई श्योर यू विल क्लियर दिस एग्जाम. 250 अब टारगेट हमने बढ़ा दिया है ना. यस, चलो. ओके, नाउ वी फाउंड दैट to detect thymine deficiency, we measure transketolase activity. Transketolase activity. T4 thymine, T4 transketolase activity. T4 thymine, T4 transketolase activity in RBC. Okay. We found that chronic history of alcohol use, wernicase encephalopathy. This is acute complication of thymine deficiency. Mnemonic is Goa. ग्लोबल कंफ्यूजन, ऑप्थेल्मोप्लेजिया, एटेक्सिया. जब तुम गोवा जाते हो तो कपड़े नहीं पहनते, वियर नहीं किए गोवा में. यू आर सो कंफ्यूज, टेकिंग सो मच ऑफ अल्कोहल, कंफ्यूज हो गए. यस, ऑप्थेल्मोप्लेजिया, एक के दो दिखाई देने लगे. एटेक्सिया, कदम लड़खड़ाने गए लगे, कहीं और किसी के रूम में चले जाते हो. यस, इट इज ड्यू टू बाइलेटरल मेमिलरी बॉडी लीजन. यस, मेमिलरी, वियर नहीं किए, गोवा, अल्कोहल पिया, सब आपस में रिलेटेड है. याद रहेगा. Korsakoff psychosis, anterograde amnesia, confabulation is there. Yes, amnesia is there. Confabulation means filling the gap with past memory, filling the gap with past memory or false story. False story. A old person, Babaji, came to your OPD. You asked what you took in breakfast. Baba said, in breakfast, I went to Hotel Taj with my girlfriend. His son said, no, no, Dr. Saab, he has not gone to Hotel Taj with his girlfriend. He was at home. घर पे कुछ नहीं. Uh, Actually, Baba went to Hotel Taj 6 months back with his girlfriend. He forgot what he took in the breakfast, but he filled the gap with past memory. बाबा गया तो था, बाबा गया तो था, लेकिन वो 6 महीने पहले गया था. Yes. So this is honest lie. Honest lie. बाबा इज ऑनेस्ट. यस, उसे नहीं पता वो झूठ बोल रहा है. यस, ऑनेस्ट लाई. चलो. विटामिन बी टू राइबोफ्लेविन, रिबन ऑफ मजेंटा कलर. कैसे याद रखोगे? एक्टिव फॉर्म एफएमएन एफएडी, रिबन. व्हेन यू आर स्मॉल किड्स, यू यूज रिबन एंड ग्लू इन आर्ट एंड क्राफ्ट. क्या कहा मैंने? जब छोटे थे तो रिबन और ग्लू यूज किया तुमने, आर्ट एंड क्राफ्ट. ग्लू क्या, क्यों याद रखा? टू डिटेक्ट बी टू डिफिशियंसी, वी मेजर ग्लूटाथायोन रिडक्टेज एक्टिविटी इन आरबीसी. ग्लू. सो रिबन एंड ग्लू. But now you are quite adult. No, now you use ribbon of magenta color for other purpose. Yes, when you use blindfold, it cause circumconal congestion, keratitis. It can cause angular stomatitis, glossitis. Okay, तो थोड़ा नोटी हो जाओ, fantasize करो, and you will find all the symptoms of riboflavin deficiency. Okay. B3, yes, B3 नियासिन टॉक्सिसिटी. B3 हमने डिस्कस कर चुके हैं. नियासिन टॉक्सिसिटी क्या होता है? फ्लशिंग, इचिंग, रेडनेस. ओके. Normally, water soluble vitamins don't cause toxicity, but we found B3 can cause, yes, flushing, itching, redness, and these symptoms are prostaglandin mediated. So, can be prevented by aspirin. Okay, maybe a question. B5 pantothenic acid, 5. Yes, toes, how many toes in your foot? 5 toes, 5 toes. Burning foot syndrome, 5. Mnemonic. Burning foot syndrome, B5 deficiency. Yes. Yes. B6 deficiency, 6. Sense toxicity. B6 can also cause toxicity. फटाफट करो यार, 7-8 पेज बचे हैं, फटाफट कर लेते हैं. 6. Yes, sensory neuropathy, numbness, tingling sensation, SIX6. Active form, cofactor. Yes, active form is pyridoxal phosphate. Pyridoxal phosphate, active form. Cofactor for transamination, we have discussed. To detect B6 deficiency, we measure transaminase activity in RBC. In RBC. 6. X, oxaluria. B6 deficiency lead to oxaluria. X, xanthonic acid uria. Homocystinuria. Yes. B6 deficiency lead to microcytic hypochromic anemia. क्यों? Because B6 is cofactor for heme synthesis, rate limiting enzyme for heme synthesis, ALA synthase. B6 is cofactor. So microcytic hypochromic. Cofactor for glycogen phosphorylase, Thanos, you remember? Thanos. How many stones? 6. B6 is cofactor for simple decarboxylation. Histidine to histamine, simple decarboxylation. Glutamate to GABA, simple decarboxylation. Cofactor is vitamin B6. Question. Simple decarboxylation, S for simple, S for 6. Oxidative decarboxylation, O for oxidative, O for 1, B1. Oxidative decarboxylation, cofactor is vitamin B1. Yes? Yes. Clear? Pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, branch chain alpha ketoglutarate acid dehydrogenase. Now, folic acid, active form is tetrahydrofolate. Dihydrofolate reductase convert dihydrofolate to tetrahydrofolate. Methotrexate inhibit dihydrofolate reductase. Question. Folium is leaf. So source of folic acid is green leafy vegetable. It is absorbed in jejunum. If you see the leaf, the zigzag end of leaf, zigzag jejunum. Folic acid deficiency also lead to homocystinuria, megaloblastic anemia. B12, cobalamin. Parietal cell of stomach secrete intrinsic factor. Parietal cell of stomach secrete intrinsic factor. This intrinsic factor bind with B12 to form intrinsic factor B12 complex. And then it is absorbed in ileum. So if there is any locha with stomach, any disturbance with stomach, or any disturbance with ileum, ileectomy, question in our FMG, ileectomy lead to B12 deficiency, gastrectomy lead to B12 deficiency, gastrectomy, ileectomy, atrophic gastritis lead to B12 deficiency, pernicious anemia lead to B12 deficiency, pure vegetarian, B12 is present in animal source. Okay. In B12 deficiency, methylmalonyl coenzyme is increased. We have discussed. Subacute combined degeneration of spinal cord, also symptom of B12 deficiency. Okay. Now, vitamin C, ascorbic acid is also called absorbic acid. Yes, vitamin C ascorbic acid helps in absorption of iron. It converts ferric to ferrous. Iron is absorbed in ferrous state. It converts ferric to ferrous. Vitamin C deficiency, yes, lead to scurvy. You know, C as C, samandar, is having water, matlab hydroxy. So vitamin C is required for hydroxylation of proline and lysine in collagen. Proline is converted to hydroxyproline, lysine is converted to hydroxylysine with the help of vitamin C. कैसे याद रखोगे? सारा समंदर मेरे पास है, एक बूंद पानी मेरी प्यास है, तो केजरीवाल जी कहेंगे पी ले, तो पी ले. प्रोलीन एंड लाइसिन. Proline is converted to hydroxyproline, lysine is converted to hydroxylysine. Yes, this helps in post-translational modification of collagen. If vitamin C is deficient, collagen is not matured, so there would be delayed wound healing, scurvy, bleeding gum, wide line of Frankel on X-ray would be there. This question was asked in this. Yes, vitamin C deficiency, gum bleeding, yes, perifollicular hemorrhage means vitamin C deficiency. So which enzyme? Prolyl hydroxylase. Prolyl hydroxylase. Lysyl oxidase cofactor is copper. Tyrosinase cofactor is copper. Prolyl hydroxylase vitamin C is required. Clear? Got the point? Speed सही है? Thumbs up कर दो बच्चों. Yes. T4 thymine, T4 transcriptolase, riboflavin, ribbon and glue, B6 pyridoxine, transaminase और tryptophan load test. Okay. 9 folic acid, F4 folic acid, Figlu test, histidine load test भी कहते हैं इसे. B12 मिथाइल मेलानिल कोएंजाइम में चेक करते हैं. यस, 2-3 पेज बचे हैं, बस होने वाला है. विटामिन ए, frequently asked question, they will give you triangular Bitote spot, most specific manifestation, triangular forming deposit of creatine at bulbar conjunctiva. Vitamin A deficiency also lead to phynoderma, follicular hyperkeratosis, toad-like skin, follicular hyperkeratosis, dry, scaly toad-like skin at elbow and knee. This phynoderma also occur in essential fatty acid deficiency, not synthesis, essential fatty acid deficiency. Vitamin A toxicity lead to pseudotumor cerebri, increase intracranial tension resembling brain tumor. Okay. विटामिन डी पे क्वेश्चन आता है. पहले ये 25 हाइड्रोक्सिलेज लीवर में होता है, ये स्किन में होता है, और ये किडनी में होता है. यस, 1 अल्फा हाइड्रोक्सिलेज किडनी में होता है. याद कैसे रखोगे? लिव 52, लिव 52. तो लीवर 52 बड़ी कॉमन दवाई है, तो 25 हाइड्रोक्सिलेज लीवर में। तो सीक्वेंस क्वेश्चन वाज आस्क्ड ऑन सीक्वेंस। तो सिल्क, skin, liver, and kidney. In our FMG, they ask question, what is the sequence of the synthesis? First skin, then liver, then kidney. Mnemonic is silk. Yes, silky skin. Okay. Yes. 1 alpha hydroxylase is kidney. बच्चा एक ही अच्छा, kid एक ही अच्छा। 1 alpha hydroxylase rate limiting enzyme, किडनी में 1 alpha hydroxylase होता है। इन एफएमजी दे आस्क लेंजिस्मस स्टिडुलस, कुछ नहीं है, ये नाम बदल रखा है, लेंजोस्पाज्म को इन्होंने लेंजिस्मस स्टिडुलस कह दिया। यस, दिस इज लेंजोस्पाज्म, इट अकरेड ड्यू टू विटामिन डी डिफिशियंसी, विटामिन डी डिफिशियंसी। ओके। विटामिन ई, मोस्ट पोटेंट लिपिड फेज एंटीऑक्सीडेंट। ओके, रेयरली आस्क्ड क्वेश्चन है, बट चेन ब्रेकिंग एंटीऑक्सीडेंट क्लासिफाई करते हैं इसे। प्रोटेक्ट आरबीसी मेम्ब्रेन फ्रॉम फ्री रेडिकल डैमेज, सो इफ इट इज डिफिशिएंट दैट लीड टू हेमोलाइटिक अनीमिया। एंटी एथेरोजेनिक बिकॉज इट कन्वर्ट ऑक्सीडाइज्ड एलडीएल टू रिड्यूस्ड एलडीएल और नॉर्मल एलडीएल। इन vitamin E deficiency, neurological symptoms similar to B12 deficiency may be present. Okay. Vitamin E. Vitamin K. K for coagulation. कोगुलेशन, ये अपने आप बताएगा। जी फॉर गामा, गामा कार्बोक्सिलेशन। GUL फॉर ग्लूटामेट, गामा कार्बोक्सिलेशन ऑफ ग्लूटामेट ऑफ क्लोटिंग फैक्टर 2 7 9 10। 2 plus 7, 2 plus 7 is equal to 9, next is 10. Okay, we found that clotting factor is converted to active clotting factor, active form of clotting factor. Yes, in this vitamin K is converted to epoxide form. Epoxide form is converted back to reduced form by epoxide reductase, and this epoxide reductase is inhibited by warfarin. This image based question was asked, this box was given, and they gave this image and they asked which compound is this. The answer was warfarin. Okay. So vitamin K dependent carboxylation. In clotting factor, carboxylation is vitamin K dependent, but we have learned that most of the carboxylation, जहां पे भी हमने carboxylation पढ़ा है, the cofactor is biotin. Yes, most of the carboxylase cofactor is A, B, C. ATP is required, biotin and CO2 is joined. Just like acetyl coenzyme carboxylase, pyruvate carboxylase, biotin is cofactor. But this carboxylation, gamma carboxylation, G4 gamma, G4 glutamate, gamma carboxylation of glutamate 2 7 9 10, we require vitamin K as cofactor. Clear? Vitamin K is synthesized by intestinal flora. So that's why newborn baby gut is sterile, can't synthesize vitamin K. That's why all newborns are given vitamin K injection to prevent hemorrhagic disease of newborn. Okay? क्योंकि gut synthesize करती है विटामिन K को। निमोनिक क्या है? कौन बनेगा पति? कौन बनेगा पति? विटामिन K, बायोटिन and pantothenic acid. Pantothenic acid. If yes, these are synthesized by yes, करोड़पति सही बनते हैं, पति कोई कोई बनता है, नहीं उल्टा हो गया। यस, पति सही बनते हैं। कौन बनेगा पति? यस, विटामिन के, बायोटिन एंड पेंटोथेनिक आर सिंथेसाइज्ड बाय इंटेस्टाइनल फ्लोरा, and if you give prolonged antibiotic, intestinal flora is disturbed, that can lead to vitamin K deficiency, biotin deficiency, pantothenic acid deficiency. Now ectodermatitis enteropathica, this is autosomal recessive disorder. Defect in zinc absorption in intestine, yes, enteropathic. जब जिंक एब्जॉर्ब नहीं होगा, जिंक डिफिशियंसी होगी, डायरिया, डर्मेटाइटिस। टिपिकल एक्रल रीजन, एक्रल मीन टिप ऑफ फिंगर, पेरी ओरिफिशियल, टिप ऑफ फिंगर, पेरी ओरिफिशियल, yes, dermatitis. Diarrhea, dermatitis, periorificial acral, zinc deficiency. Diarrhea, dermatitis, typical Castle-Neck appearance, plus dementia, that is pellagra, niacin deficiency. Okay, so sometimes they try to confuse you. So inflammation around nose, mouth, anus, cheek, this is periorificial, that is acrodermatitis enteropathica, zinc deficiency. Yes. Okay. So we take a break of, ब्रेक लेते हैं 15। ओके सर, क्लास लेंगे, उसके बाद मैं वापस आऊंगा। मैं वापस आऊंगा, ये वादा है मेरा। ठीक है, चलो, थोड़ा सा रह गया था, बट एनीवेज आई विल वेट। एंड सर ज्वाइन कर रहे हैं, सो वेलकम सर, सॉरी फॉर inconvenience